how do we manage the risk of an aging workforce so that we keep them productive and so forth. So we'll be merging those two as well in that fashion. So please make sure if you came with a colleague, please make sure that you are spread evenly so that we get the majority of the work done in a manner that it will allow us to achieve what we need to achieve. And the plea here is, we already know that you have the responses, you have the answers, you have the ideas. Raise your concern, but also provide an opinion of how you think that should be addressed. We deliberately insisted that the departments must send practitioners, must send the people that are working in this area, for that particular reason, that you are the ones who understand what the challenges are, and you are the ones that know what changes are needed. So please make sure that we have that. The health risk managers are here because they will also be providing the professional backup of the challenge. So if you have had challenges in terms of how the turnaround times, the processes that has been followed and so forth, if you have responses to that or ideas on how we should deal with that, then we should be able to deal with that. But now I want us to proceed. There are two gentlemen that were having flowers yesterday and giving goodies. I can't see them now. I think they ran away. They're supposed to make a presentation. So yesterday we asked colleagues to take an exam. I call it an exam because it had about 30 questions and they were quite detailed. They have done an analysis. They didn't sleep last night. So that thing of that we're being told that they must say, no, we can't work at this hour, it didn't work for them. But it was not because of me. They had promised to do it. Where are they? Him, I thought. Stress. They are not being resilient. Prince, Tumelo, they want us to clap for them as they come. Yeah, they want to make a grand entrance. But piano nyana for them to come in. So please come and make the presentation. It's about, these are the responses that you gave. They've done an analysis and they'll be showing us how it's done. All right, please, gentlemen.
Greetings to everyone. Greetings to DG, to our speakers, our directors, deputy directors, managers, and senior managers of EHW. My name is Prince Mohale from DPSA, Office of the Director General. Okay, we will be giving you guys, colleagues, oh, no, you will use it. The reflections from the attendances. So I'm here with Mr. Tumelo Siema. He is also from the office of the DG. So guys, I wanted to, just before we start, to tell you something. There's a say that is saying police officers are always being called nonsense and useless up until they start looking for you. So what I'm trying to say is that when we see our presenters in front of here on the stage, it is simple for us, but once you are being called to come on the stage, it's something else. So I'm going to give my colleague here to start with the reflections, and then we'll continue. Thank you.
Morning, colleagues. My colleague did not observe the protocols. All protocol observed. Colleagues, the survey was conducted to you guys for you to complete so that we can review the employee health and wellness program. So most of you did not complete, so which gave us a problem because we only had 92 responses. And yesterday we had about 150 colleagues attending. So it's a problem. So the reason for this, it was for us to understand the mental challenges that you guys are facing in your workplaces. Because we know the significance of mental health management. We've had our presenters yesterday. We also had a brigadier who entertained us yesterday. So I believe we all responded with positive inputs. Oh, matot. No, I'm telling you, there's nothing. Okay, should I continue without the slide? Is it okay? We are used to load shedding, so what do we call this one? Sure. I can sing so long. Oh, we've extended the invitation to all 9 provinces. And we've had the most attendees are from Gauteng province with yeah. Okay, we don't have the percentages displayed, but the most attendees were from Gauteng, followed by Mpumalanga, the Eastern Cape, KwaZulu-Natal, I think it was 2. And then we have a province called National. I don't know which one is it. Okay. What's happening? Okay, and the departments that were able to attend, we had the Office of the Premier, which was the most attended colleagues. We also had the Social Development, the Economic Development, followed by Roads and Transport. Thank you. Next slide. The designation, the most attendees that were able to complete the surveys were the deputy directors, the senior managers, and the assistant directors, as well as the ASDs. Apologies. Apologies for that, colleagues. And then on the salary levels, we have level 1 to 4, 5 to 8, 9 to 12, and 13 plus. From the colleagues that were able to complete the surveys, we had 61 on salary 9 to 12, which was the highest. Next slide, Howard. This thing is not working. Okay, the question was posed on how long have you been in your current role as a pillar or EHW or OHS practitioner. We had colleagues who have indicated that they've started in 2005. Some said they started in 2003. So we had to round off and make calculations. So some were 20 years, some were 18 years, but most of you who completed, we had 5, those who have 5 years as practitioners. Another question was posed on the name or on the statutory body, and the highest was the SAC-SSP, followed by the SANC, and Mpumalanga. Okay. There's a question also that was posed on what are the recommendations that the DPSA should consider to professionalize the functions. Most of the colleagues have indicated that they should professionalize the EAP and also professionalize the development of the EHW, as well as interest of professionals. That one I did not get right. They should also have the social workers and have relevant professionals. The question was also posed on, take it from here, my colleague. Okay, colleague will take over.
The first question was, what recommendations should the DPSA consider to professionalize the function? So the first answer was, this is the first person to answer, was make it compulsory for EHW employees to register with professional bodies. Number 2, compulsory appointment of EAP professionals in all the departments. Number 3, to ensure that officials doing these functions are solely responsible for them. Go digital, employ relevant skilled personnel, and be compensated at the same level as OSD, social workers. Question number 2, what do you, okay, sorry. What do you consider to be the most important aspect of the PILIR and EHW policies? The answers are as follows. To have a fully functioning EHW program to implement the policies. Assisting employees struggling with workplace issues and illness. To guide the employees on how the policies work. Providing guidelines to departments on the implementation of EHW programs and strategies, adhering to the turnaround time in implementing the outcome of women resource management. What are the challenges regarding the implementation of a PILI policy and EHW strategic framework in your department? Number one, lack of support from management. Wrong officials in the correct position. Most employees don't understand how PILIR policy works. PILIA. Many just don't manage PILIA. They're leaving it to, okay, many just don't manage PILA. They're leaving it to HR while it has to start with them. What recommendations can be made to improve the implementation? Number one, officials responsible for implementation should be taken for extensive training on the program. Public service should appoint medical doctors or specialists to administer PILIA. Managers need strategic engagement training on a continuous basis, and it must be incorporated into their job description as management of PILIA. What do you recommend to improve the service offered by James, including screening? Number one, help interpret the results, work closely with wellness practitioners, honor events request. Number two, to ensure that the medical scheme is properly managed and officials who consult are treated with priority. Number three, each province to have James personnel and be able to service all staff in all the district. Okay, I can continue. Yeah.
Colleagues, the question was posed if you were satisfied with the health risk manager concept provided for in the PILA or PILA. Colleagues have responded yes, which resulted to 91%, and those who have responded no resulted with 9%. For those who said no, their reasons were the turnaround time. The management should understand the decentralized service, and also the Department of Health, health practitioners not sure, physical assessment, and referral and cases. I think there are few that are linking on the responses. Also, when it comes to, I don't know, there's a colleague who said they must bring back SOMA. Because SOMA is a service provider and the question does not relate. Can I go back? So does colleague agree that DG brings back SOMA? DG, SOMA. Yeah. Okay. As the EHW program integrated with PILA program in your department, colleagues said yes, 71%, and others said no, 29%. The follow-up question was, how can it be integrated? Some said they should process the application and also have a constant communication. Colleagues must have necessary support. There should also be intervention and referral. Okay. A question was also posed on, have you ever processed incapacity leave or ill health retirement? It was 53 who responded yes, 47 who responded no. Okay. The follow-up question, they said the processes are being delayed, and also some say it was easy, but on the second question, second last question, they said it was difficult. So others, they said there's a long time. Yes. Okay. Did you face any challenges or obstacles during the application and approval of the process? 82% said no, while 18% said yes. The follow-up question, how can it be improved? Okay, they say PILA and EHW can be integrated, and then the application should also be, let's leave this one. Okay, it should also be easy to be processed. What are the recommendations that you can make to improve the support, role, and guidance of the HR? Processing EHW roles, application and of HR personnel, process incapacity awareness. Okay. What recommendations can you make to improve communication and keep applications? Being in contact with applications, there should be regular updates. There should also be home visits by PILA application to do PILA applications. There should also be reporting systems, communication by communicating, and also be able to track your applications with your employees. What are the measures that can be introduced to improve the applicants' understanding of the financial implications? Okay, employees must be accountable, conducting awareness, information system, workshops and workshops with employees. What can be introduced to improve the transition back to work from incapacity leave? There should be reasonable accommodation, which was discussed yesterday, work strategies, period of incapacity, and also reintegration. What support must be introduced to support supervisors to successfully integrate the return to work? Okay, and then there should be management and supervisors, workshops and trainings, meetings with supervisors, supervisory training as well, employees on capacity, training, temporary employee as well, management, relevant supervisor. Oh, the end. No, that was the last slide. Oh, thank you. No, go ahead.
Oh. You wanted to say last, oh, your question. Oh, okay. No, thank you so much. Please clap for the two gentlemen. I hope that even the people that you work with as interns in your offices are given such roles because it's them that did the analysis. It's them that worked with Dr. Foromo and Desmond to come up with the questions, and they came up with that presentation. We will go back to some of you to understand the answers that you have provided, so that we can have clarity when we talk about management support. What is it exactly that you want? What is it that you mean when you talk about management support? When we say employees have to be accountable, what does that mean? How do we practicalize all of those things? So I think they did a great job. We can clap for them once more. And there is one person that they didn't acknowledge, or maybe I missed it. And she did say that we must acknowledge her because she was designing the system behind it. So please acknowledge Khaba Ureds. So these people, if you don't acknowledge them, they come to me on the side and said, we are no longer working with you. So I'm scared of them. Because without them, I won't be able to function. But colleagues, that's I think what we wanted to show is that the work that we are doing is feeding back to what we will be doing moving forward. So I don't think we need to have any discussion on that. It was just a feedback to say, these are the views, these are the top 3 things in each of the questions that you have been saying. You want us to improve, when we talk about professionalization, you want us to promote registration with professional bodies. You want us to start talking about being strict in terms of who we appoint as a practitioner in the departments, all those and all of those things are coming out strong, and it's feedback from you as participants in this endeavor. So what I want to do, with your approval, of course, is to take the 2 presentations, and then after those 2 presentations, we can have an open discussion, including with the feedback that has come up from you. Remember, they are not going to be answering questions. It's your feedback. It's the information that you have provided. So you can't be asking them anything about your work. You can just tell us and say, this is how we do it, and this is how we think we should improve it. And ours is to take it and then make sure that we implement it. I'm going to invite Adele to come to the stage. Professor Zungu said he has someone better to give to us. He said he can have a seat. He said he has someone better who will be presenting on his behalf. So we are grateful that she could make it. And then I also want to invite Dr. Makwekwe to come to the stage, please. So Adele will be presenting on the return to work, the reintegration program. Dr. Makwekwe will be presenting on the building resilience in the workplace. And these are the things that we spoke about yesterday. Unfortunately, both of them were not here, so I hope they won't be repeating what we have already discussed. All right, is the presentation on REDS? Not yet. Okay, you say when you acknowledge someone before they finish their job, this is what happens. I'm joking. The stage is yours. So you greenness, yeah.
Perfect.
You just point on it. I took it off. But you can start introducing yourself and your credentials.
No worries, no worries. Good morning, everybody. My name is Odette Farming.
People on the platform.
Shall I start here?
Yeah.
Perfect. Good morning, everybody. My name is Odette Farming. I'm an occupational medicine specialist. I'm based at the Occupational Medicine Department at the National Institute for Occupational Health. So it's a privilege to be here with you guys this morning. So my presentation today is going to be about return to work and reintegration into a reintegration program. And it's going to be more about just elements of the program that we need to think about. So sorry, I'm just trying to get this to move.
What point did it? Seems to be a problem.
Oh, there we go.
Yeah.
Thank you so much. So, I think that just as a point of departure, I thought it was important for us to think about, the classification of functioning from the WHO and just get a little bit of the terminology around impairment and disability and work. And so, it sort of always starts with the medical condition. And I guess now that we're thinking about mental health, there could be schizophrenia, there could be, anxiety and depression, a mood disorder, bipolar disease. So that would be the diagnosed condition. And this diagnosed condition oftentimes leads to an impairment. And the impairment is the loss of structure, if it's physical, but also the loss of functioning, which could be, impairments in attention and concentration. It could be impairments in a motivation to do certain tasks or to look after yourself. And impairment then can lead on to a disability where you're having the loss of activities of daily living and these limitations. And in the workplace, this could cause significant problems. And when we're looking at disability, oftentimes it's different for different people. So even if you have the same medical condition, you can have different levels of disability and limitations in your activities. And these can sometimes be based on the environment that you find yourself in, if the environment is enabling or not, as well as personal factors and resilience and things like that. So when we're assessing someone's fitness for work or someone's ability to return back into the workplace, it matters less about the medical condition, but a little bit more about the impairment and the effects of that on somebody's functioning and level of disability in turn. So when we're looking at mental health conditions, there's not too much information from our setting, but just looking at some statistics from the United Kingdom, we know that mental health disorders significantly affect people's health and people's well-being and their productivity in the workplace. And in the UK, mental health conditions affect 17% of the population and at a cost of around £70 billion, which is quite significant. And it accounts for sickness absence of about 70 million working days that are lost in a year. And a lot of the time, more than half of the disabled people within the UK have a mental health condition that is with or without a musculoskeletal condition. So those are the commonest causes of disability in the working population. And it's important, and I'm sorry, but I'm going to repeat this a few times, that it's important to recognize that work is good for you. And good work and paid employment are beneficial for the mental well-being of people. So this is just a few more statistics, also sadly from the UK, that I picked up on. One of them that looked at stress and depression and anxiety, accounting for 15 million working days lost. Also in terms of long-term sickness absence, 19% was due to mental health conditions. Also an interesting statistic that people with long-term physical disabilities, 1 in 3 of them have on top of that, it's complicated by a mental health condition as well. And even though we're thinking about mental health conditions can occur, in the community and have multiple causes, it's important to note that work can also be a cause of work-related stress and occupational stress that can affect our working population as well. So what does the data say in South Africa? As I mentioned earlier, there's not too much of it, but there was one study that was done in 2016, and this study was looking at health professionals and their sickness absenteeism and the determinants of the incapacity leave approvals in the Gauteng Department of Health. And this study showed that within that population, there was at the time more than 1,000 episodes of approved incapacity leave. And 41% of that leave was due to or was from professional nurses who had applied for that leave. And the main medical reason was firstly mental health, followed by musculoskeletal disorders. So we know that even in our setting, it is a substantial problem that we need to tackle. Okay. So, I alluded to in the introductory slide, the fact that, work is good for us. Good work is good for us. And there are quite a few benefits of working, and they start from, it minimizes physical, mental, and social effects of sickness absence. And there are definitely better health outcomes in people who are working. And work is also therapeutic. It's also part of rehabilitation. And so it has these benefits. And particularly in mental health conditions, it improves your social status working. And it also, there's a potential for having a supportive environment, contact with people in the workplace, and also a daily routine that could be beneficial for people who have mental health conditions. So the benefits of work far outweigh the risks of working. And there's also risks of not working. And when we look at the risks of not working, basically there's the evidence proves that there's adverse health effects when you don't work. And there's poor health, there's also financial issues. So it also leads to health inequality. And it's also associated, people who are not working have a sense of despair, and, it can increase issues of mental illness and even in some cases suicide. So there's actually, within mental health conditions, there's a complex relationship between work and the mental health conditions. And, there's some severe mental health illnesses that really do pose a challenge to being capable of work, like, the extreme severe schizophrenias. It's difficult to, for people to work with those kind of conditions. But conditions where there is anxiety, depression, mild to moderate, people can still, the workplace can still have a place for them. However, this is, in the precondition that there are jobs available and that there is a chance of gaining employment, and that there's allowances that can be made for age, with aging population. Out there. And as I said earlier, it's increasingly recognized that poorly managed or there's bad work that actually can be a contributor to someone's mental illness. And so organizations, ideally, with the help of occupational health in the organization, they really do have a moral, a legal, and even an economical reasons to support people or to support the mental health of their workforce, and to consider workplace adjustments to accommodate employees with mental health issues. Okay, so just looking at the legislation that guides our practice, we always start out with the Occupational Health and Safety Act. And the Occupational Health and Safety Act says that it's the duty of the employer to provide as well as to maintain a safe working environment. Has a similar, a similar regulatory role. There's also, we have the basic conditions of employment that even looks and takes us to the minutiae of pregnant women and night workers, and what's fitness, what's their fitness standards and what accommodations need to maybe be made for them. But recently, we've had an amendment to the Compensation of Occupational Injuries and Diseases Amendment Act of 2022. And, the COIDA before was looking at, compensation of occupational injuries and occupational diseases. And now there's an addition to this role. It doesn't only pay for medical costs and pay for a compensation when people are injured or get diseases from the workplace, but it's taken it that step further in the legislation, and it now looks at clinical rehabilitation as well, provision of assisted devices for physical as well as psychological recovery of people and reintegration of them back into the workplace after an occupational injury or an occupational disease. It looks particularly at vocational rehabilitation, how to get back into work, and also social rehabilitation to try to assist in restoring an employee's independence and their social integration to the maximum that they can be. So our legislation is now very enabling, which is a good place to start from. And there are, I'm sure you've spoken to this because I heard a little bit of your own comments earlier, that, some of the elements of a return to work program. And, oftentimes we sort of start in the healthcare and the medical intervention when someone comes with a medical condition. And, healthcare is the starting point. Whatever the medical intervention and the treatment is, it's definitely the starting point. But it's important to know that by itself, in isolation, it has very little, impact on work. And work is a very important outcome, particularly to the working population, that age group, from 18 to 65. That when you are dealing with treating of a patient, you have to consider the implications of their condition in their workplace and that kind of rehabilitation as well. So sometimes even just the attitude and the thinking around the medical intervention and just focusing only on the healing of whatever it be, without thinking about how this person is then going to reintegrate into the workplace can be a barrier in itself to reintegration of that person. So we also talk about we try for healthcare, and that's an important component, but also functional capability. And functional capability is often a process where standardized tools can be used to assess somebody's physical functioning as well as their mental functioning and their capabilities. And we often look at that within the workspace, in the occupational health space. We look at fitness for work. We use these tools to assess whether or not somebody is fit to do their inherent requirements of the job in a way that is safe and it's reliable. And then now we also go on to think about rehabilitation, and not only rehabilitation with regards to maybe physical therapy and occupational therapy, but also specifically focusing on vocational therapy. So this is reintegration to either stay in or move back into the workplace. And basically this vocational rehabilitation, it attempts to overcome, to adapt, and to compensate for any kinds of impairments by developing the maximum intents of whatever is the residual functioning that that person has. And so it's important to note that most conditions, recovery is the expectation. And so because of this, there may be some symptoms that persist, but for the most part, people improve in terms of when they have a medical condition. And so we need to have these systems in place in the workplace to ensure that they can get back into their optimal functioning. So the workplace management is also a critical component of this whole process. And, it starts from looking at sickness, proactively managing sickness absence. And it also looks at, having proactive return to work programs, promoting rehabilitation in the workplace, adapting and modifying maybe the environment or maybe the way people work. And so all these kinds of principles are sort of good practices when we're looking at occupational health management. And it also makes economic or business sense for the employer. But it's important to note that the research has shown that a lot of cognitive, behavioral, mindfulness, talking therapy, so the psychological aspects for both people with physical impairments to get back into the workplace, as well as mental health impairments, are quite effective, because I don't know if you saw in the first slide how somebody perceives and thinks and their personal attributes actually has an impact on the level of disability. So someone who has the same medical condition can have a different disability or have a worse disability because of some of the psychosocial issues that they face. And so tackling these psychosocial issues is quite an important role and has been effective in implementing and in people getting back to their work. So it addresses attitudes, it addresses beliefs and behaviors that can aggravate and perpetuate symptoms and disability. And there's some studies that shown common mental health problems at work. Where there's individual therapy, it's shown to be effective. Even therapy up to 8 weeks has been shown to have effective return to work and work retention effects. So what's the role of the workplace? The role of the workplace actually has an essential function, and employers have a key role to play if rehabilitation is to be successful. And a proactive, not a reactive approach is required. And even looking at this in the data and in the research, it's employees who proactively manage sickness absence and temporarily maybe modify the working arrangements has been shown to be effective, as well as not only effective for someone getting back to work, but also cost effective to the employer himself. So for both work-focused healthcare as well as accommodating in the workplace, both are required. It's a team approach. You can't have one without the other. And a lot of the research has also shown that the role of line managers is quite a critical role, particularly in managing mental health conditions in the workplace and getting that person back into the workplace. And it can't really be overlooked at all. It has major impact on employee well-being, and the interventions that we have in order to get people back into the workplace needs to focus not only on the employee, but also on the line managers in order for it to be effective. Communication is essential. In this whole coordinated effort, it's really essential. Training, and organizational approaches that actually increase participation and decision making and the problem solving and improve communication have been found to be most effective at reducing work-related psychological ill health and sickness absence. So we need to have policies and procedures in place to improve line management and to develop that skill within the line manager system. And we mustn't underestimate the challenges of these return to work conversations that actually go on between line managers and employees. Because when people feel, valued and that their input is essential, particularly in mental health conditions, it really does make a positive influence. So yes, I know you guys already spoke about adjustments to enable a return to work. And, the Occupational Health Service should have knowledge about the workplace, an intense knowledge about the workplace. And they need to assess the individual fully so that they can advise appropriate adjustments for that person's work or for that person's work environment after a period of sickness. And there's quite a bit of data that shows the success of modifying the work. And some shown that these interventions have actually halved the number of work days lost from either injured workers who went on chronic disability. So the recommendations with regards to adaptation or modification of a workplace can be broadly divided into, you could change the working hours, you could change the actual duties of the employee, you could change the actual environment of the employee to make it safer maybe. And we could also change the support or even increase the support that is needed. So there's a whole host that could be done according to how adaptable the workplace is, and also the support that you get in order to implement these changes. And these changes can either be short-term or they could be long-term changes, depending on the prognosis of the medical condition and how long somebody is going to be affected by this condition. So having said all of this, we focused, and the talk was really focused on, return to work. Somebody already has a medical condition. We're trying to get them back into the workplace, and we're trying to get them back into productive work. But it's important to remember in occupational health that even though we want to treat employees and we want to get them working and functional, it's important that, we know that there's also a risk of work, of bad work. There's a risk that employees have when work is bad. So we need to also prevent occupational stress, prevent work-related mental health conditions in the workplace. And, it goes Assess the risk, control the risk. So we do the health risk assessment. It works similarly in mental health conditions or mental health risks. We need to assess what are these mental health risks. Is it poor support in this department? Is it a lack of control that the employee feels in terms of lack of autonomy of their work, excessive work demands, poor work organization, shift work? What are the mental health risks? And what controls do we have in place to tackle these? And then in terms of secondary prevention strategies, we look at what do we have in place to ensure that we have early identification of the warning signs that indicate ill health. And, you know, we have occupational health services that should have things in place to be able to recognize this. We also have the EAP programs that we spoke about a little bit earlier, and also the line managers' awareness of when are they picking up that there's maybe an issue, so you can identify these issues early and then be able to tackle them in the workplace. And then basically our tertiary prevention is once we've picked it up, we need to have rapid treatment for people who have mental health disorders and rapidly reintegrate them into the workplace with the appropriate support. So in terms of our take-home messages, I think it's important to remember that people who have had a period of leave because of mental health issues, and oftentimes it's a long absence, they face quite a bit of challenges of reintegrating them now back into the workplace and returning to work. But an effective occupational health service can do quite a bit to maximize the likelihood of a successful outcome and somebody being reintegrated. And this involves all those components together, as well as doing fitness for work assessments to look if, you know, what are the inherent requirements, what are the job demands here, and what are the capabilities of this person, and do they match the job demands? And if they don't match, maybe there are some restrictions. What adaptations can be made? What modifications can be made in order for them to be able to function in that role? I think I alluded to this earlier, prolonged absence and prolonged absence from work is detrimental to the mental, physical, psychological well-being of a person. And the opposite is true, that good work is actually beneficial. And a patient's return to work as soon as possible is the aim of the game. That's the goal, you know, with the support, not just put in the deep end, but with appropriate support is the goal. I think there was one study that showed that people who were off work for more than 2 years were less likely to ever get back into their workplace, which is a little bit scary, you know. And so occupational health professionals have a vital role to play, not only in reintegration, but in preventing, and to have systems in place to prevent any additional insults to somebody's mental health because of work-related stresses and risks that can be avoided. And mental health conditions are treatable. Recovery is the norm. You could have maybe some dips as you go along, but recovery is the norm. So getting people back into productive work is the first prize. Thank you for your attention.
Thank you so much. Let's please clap for Dr. Odette. I think that's one of the interesting concepts of stress. There was one person, prominent person, who was sent to jail, and they applied for early release because they became stressed in jail, and they were granted that parole, medical parole. So this concept of stress, and we need to really understand it, because it is some of the, you have some positions that would be stressful to you. So the question is, how do you manage those, right? So it will be quite interesting. Can we please have the next presentation on so that we can understand more how we build on those stressful situations so that we become more resilient? Dr. Makwekwe.
Awesome. Good morning. Good morning. I'm so happy to be here. What a pleasure. What a privilege. Such an important topic. So yeah, I did a little dance when I finally got confirmation from Robert, Dr. Foromo here, that I would have this opportunity to speak. So I just want to highlight my topic by getting everyone to think about what we saw earlier on, because I always try as an educator to kind of find teachable moments, because that's the best way to learn. You know, we can see it and we can be told about resilience, but actually when we get back to work and we have to do what we need to, we can forget, right? Every human being suffers from what is called a knowing-doing gap. Knowing and doing gap. We know we mustn't text when you are driving, but sometimes we do it, isn't it? We know we mustn't spend many hours on social media. Sometimes we do. We know if it's me, I even did it at the breakfast. I mustn't have the extra croissant, but I did. Everyone does that, right? So we have a knowing-doing gap. So the same applies to learning about resilience. So I want to make it practical. So what did we see this morning? Firstly, I just want to compliment the young gentleman there in the Premier's office, because we saw an example of resilience. What is resilience? Resilience is the ability to adapt to stressful conditions. There you go on stage. Hey, before Jabuya, this slide has disappeared. And already they told us, when the policeman is looking for you, it becomes a different story. In other words, they say, I'm a little bit scared. I'm a little bit anxious to be on stage. Then the computer lets you down. What do you need? Resilience. And I think they did well. And what we saw was individual resilience, meaning I am facing an obstacle. I'm facing stress. I'm anxious. I'm worried. I think I failed. I'm letting someone down. That's all happening in your mind. And when you are resilient, what do you do? What do you do? You adapt to what's going on. We saw a little bit of humor. The slide has disappeared. A little bit of giggling and laughing. That's an individual managing so that's managing resilience at an individual level. Let's move to the workplace, because it was there. What did we see about the workplace? We saw you encouraging them. You are their team members. You were encouraging them. It's okay. Be calm. They're trying to find the slide for you. And so we see in the workplace, when we talk about resilience, we've got my resilience as an individual, but we also need the team to play its role. And we saw some elements of that happening. We also saw another very important component of resilience in action: the role of the manager. And of course, the manager represents the organization. So the organization plays a big role. You saw twice we were asked to clap for them. There is the manager acknowledging, my goodness, you did well. It was a little bit stressful. It was a little bit challenging. You dug deep, and the results show. So in what we saw earlier, and that's what I'm going to talk about, we saw the role of individual resilience. And you heard a little bit about that yesterday. We saw the role of the team leader or the organization in helping me to be more resilient. And we also saw the role of the team. So kind of have that picture as we navigate my slot, that we're really talking about this amazing concept of resilience, but it can't just be your individual resilience. It's got to be, what is the team doing? You can be very resilient. Then you get to the office. And you know it, you are laughing, I don't need to say it. The team takes away your resilience from what is happening in the team, whether it doesn't have enough resources, as an example, or we have no self-care, or we blame each other if mistakes happen. There's just so many things. So I want to underline, you can be here and say, I am resilient. I have high levels of that's okay. But that's not going to take you far if the team that you are part of strips away your resilience. At the same time, we need to acknowledge the role of the organization, mostly represented by your direct manager. That person needs to manage in a way where they constantly ask themselves, do I lead? Do I manage in a way that enhances the resilience of my people? Because the leader can be culprit number one, taking away, breaking their people's resilience. And it's not because they are deliberate, it's just because of the way they are managing. So we're going to weave this link between individual, team, and the role of the organization in resilience. So I'm a little bit anxious because I saw people were clicking, and things were not happening here. I must just acknowledge, but it looks okay. I'm also a little bit anxious here, but I'm sure it's going to be okay. So let me tell you quickly about myself. Why do I love this topic? Oh my goodness, resilience. For me, resilience represents a secret sauce. You know, they tell us in Coke, there's secret sauce. KFC, chicken licking, kuna secret sauce. Hey, Bafouet. Irresilience. I hope at the end, I don't need to convince you. You will say yourself, aye, the good doctor was right. Resilience, it's a power. How do we know? Firstly, I was unemployed for a long time as a young person. So I'm testifying to the power of resilience. I know what it means at 20 to be unemployed with good metric. Not only that, going to the factories, Buffett, and seeing that sign, that is so destroying. Because that is saying to you, Ish, don't waste time. Don't try to come inside. There is no way, move on. I mean, guys, think about that when you're unemployed. Rejection. You are in a space where you need another human being to say it's going to be okay. Good luck with your job search. No, we don't do that. We don't have time. We say read, move on. Hi, Buffett. That happened to me for a long time, right? So I know a little bit about resilience from that. Also, okay, then now I need resilience here. Where must I point? Okay. Not only do I know from this, I must point somewhere. I also know from arriving in Johannesburg in 1992, staying with my aunt for 6 weeks. You know, black people, we just arrive. You don't need to invite us. Hey, we are my relative. You are in the big city. Oh, I just arrived. Do you agree? So I arrived at 52 stand of mention. Yo, I saw flames. She couldn't look after me. I became homeless. 7 months, 28 weeks. I slept like that. It's not me on the picture. I slept like that young man. Just FYI, it's not me, but I slept like that for 28 weeks, 7 months at Park Station. Resilience held me. That's why I'm passionate about the topic, right? And to give evidence, DG, there is me. If you say, this guy, is it true? On a plane and wanderers. Old NC offices, Shell House. There I was, 1992 July, selling fruit and veggies. So I'm saying resilience is a superpower. So let's see, how does resilience work? How does resilience help me? So what I'm going to do is to connect the dots. We're going to build on what we spoke about yesterday. Stress, individual resilience, then we'll move into the role of the organization. Why? Because we must see they are integrated. You can be managing stress well. You can be resilient as an individual. Hey, you swipe that card. You go into that organization. Hey, Bafwet, resilience is gone because it's tough where you are. Or the manager is so challenging, right? Or there is not enough resources. It might not even be because the organization is bad or the manager. All organizations have limited resources. All organizations are grappling with change. And so it could just be the organization is restructuring. They are doing things for them to deliver services better. And that impacts you, right? So you can see the role of that in resilience. Why do we need to talk about resilience? We spoke about it yesterday. I'm not going to spend time on it. I'm just giving you the why, our true north. We are doing it so that our people have good levels of well-being, mental well-being, physical well-being, financial well-being. That is so central. So let's keep the why. We're not in here. We just want to talk about resilience. Hey, we just want to do programs to improve. No, we are doing it because it matters. We want people to show up at work, to be in society, to parent well, because at the core of what they do, right, they have a sense of meaning. They say themselves, we don't need to say it on their behalf. You know what, out of 10, I think I'm 7. My well-being is okay. That is why we need to build resilience. And so I've got a little framework I'm sharing with you there, that it starts at the bottom by an organization saying, we have people in this organization. I know it might sound funny. When we are asking an organization to acknowledge they are dealing with human beings, because sometimes there's so much pressure to deliver services, products, what you need to do. You forget this person, that is my team member. It's not just a person, they're a parent, right? They're a sibling, they're an active citizen. They don't swipe away their problems when they get into your organization. They're stressed at home, they're stressed in the workplace. Do you see the role of the organization acknowledging? Simply, we're dealing with human beings. They might have a good day, they might have a bad day. It's not because they are bad people. It simply could be there is so much going on in their lives. And so we should move away from only looking and thinking about our people, just in the context of them working for us. They are more than working for you. There's many other things going. That's what that bottom pillar is saying. And then, of course, once we acknowledge that, we do active programs, touch on a few of them, that build resilience. We get to that end goal that I spoke about earlier, improved employee well-being. You spoke about stress yesterday. I want to draw the link. Stress is just a sense of there are too many demands on me. I can't. It's too much, right? And no one needs to tell you. You experience it yourself. And good people, the thing I just want to highlight about stress and why we need resilience is this. Stress doesn't knock on the door. Do. I am here now. Oh, it doesn't work like that. It piles up because there are demands on you. Societal pressure, pressure at the office. Who did not see flames from 5% interest rate hikes? There are in your organization, the people seeing flames, the people in debt review, the people whose cars were repossessed, the people afraid of their homes will be repossessed. They are showing up every day in your organization. And in fact, this is representative of working in South Africa. They are here. Statistically, we have people here in debt review, people struggling with their finances, people struggling with personal issues, in their marriage, in parenting, but you are here, you're showing up. That is resilience. And so we need to acknowledge that stress doesn't say, go, I'm here. You just have this ongoing piling. And then you get to some point, it is too much. And that is why we need, one, to build resilience so that you know, I am feeling a little bit stressed. I am a little bit unwell. I'm a little bit highly irritable. You know, I get home. And you just go. You don't even have time. You're so busy. That's irritating. I love it. How was it at the office? Fine. And then, that is stress. That is happening. It's a sign. You must think, I am not myself. And the problem is we don't do that. And so we end up with chronic stress. And by then, a lot of intervention needs to be done. Stress affects decision-making. And I'm just showing you quickly on this chart. We need resilience because a manager who's highly stressed, hey, before you see how I'm excited about the topic. A manager who is very stressed, they don't need to tell you they're stressed. But I can tell you something. I don't even need to do the research. A manager with the high levels of stress and anxiety, their team has high levels of stress and anxiety. And so that manager is managing by making their people less resilient. So managers, you must manage your stress, right? Because your people experience it. You don't even have to say it. We talk about your style under stress. Think about you, leaders. What is your style under stress? Abanye, hey, it's hectic. I don't delegate. I do it myself. That's a style under stress. Abanye, 2 a.m. what's up? I need results. Abanye, how are you? But I'm not really interested. How are you? I want to know what's happening with my projects. Do you see? And we're not saying managers are bad. We're saying high levels of stress, compromised decision-making. And that's what that is showing you. The more stress you have, stress for too long and you need to be booked off. We don't want that. That's why we want to build resilience. How do we do it? So there is the why of resilience. How do we do it? Firstly, resilience is not about big things. We often think resilience is about overcoming being homeless. It's about, I was retrenched and I found a job, or grieving and I overcame it because I lost a loved one, right? Those are important. But resilience is simply recovering from loss, from failure, from grief, from health scare, from financial problems. It's just the ability. Things are not going well somehow, and you're going to figure out how, right? You work on it and you have a positive result. That's what we mean by resilience. So what I'm saying to you, I just realized that you didn't follow protocol, DDG. I don't know why I'm thinking about it now. I'm sorry. I was supposed to say DDG, protocol observed. And then I carry on, right? I'm doing it after. I'm sorry. Let's go. So, resilience. Thank you. Okay. Adaptability, DDG, adaptability. There you go. Resilience, DG, resilience, a skill we can build is resilience. Why? It's under construction. It's not magic. You heard a little bit about yesterday, we'll build on it today. It's something that right now you can do something about, right? So you can aim to say, I want to build my resilience. How do I do it? Bit of a busy slide, but let me take you through what's happening there. So individual resilience has 3 main pillars, right? Perhaps we touched on yesterday. Number 1, self-awareness. Self-awareness. Do I know what's going on with me? Do you know what's going on with you? I am not talking about work and all those things. I'm talking about your thoughts. your emotions. You know, when you're talking quietly to yourself, what is that talk? Because that's what builds resilience. That talk can be a lot of negative thoughts. It's tough. They don't care for me. I'm not earning enough. I should be promoted. My manager is a bully. Those are all things that someone may be saying to themselves. What does that do to you? That is stressful. It weakens your resilience. So being aware of what is happening to me. I am sad. Why? I am happy. Why? It sounds so simple, but many of us, I want to challenge you. We run our lives on autopilot. We don't know what's going on. We don't know whether we are happy. We don't know whether we are sad. Because we don't sit and reflect and really ask ourselves, what is going on to this person? You just, the boss is in a bad mood today. The boss doesn't even know they're in a bad mood. They don't, how scary is that? They don't even know themselves. Think about that. And how it's impacting their people. So the first step is not magic, but it's hard. It's constantly checking in with self and asking, how am I doing? And then you can go further in my health, in my finances, in my social relationship, in my team, in my career, in life, in the purpose that I want to make. How am I doing in all those? Because when there is a disconnect in one aspect of that, you are stressed, right? You feel you are not where you want to be. And so what we're saying is, are you self-aware? As a step, that builds resilience. Number two, social connection, social support. We saw it during COVID. I need not tell you. One of the biggest problems the world is experiencing today is loneliness. There is a crisis of loneliness in the world today. Right? For many reasons. And remember, loneliness is not that I'm shy. I don't know. It's desiring contact with other humans, deep contact, and not getting it. Right? Someone understands me. Someone gets me. Someone values me. They're in my corner. They compliment me. I matter to them. When that is not there, you can be sitting here. We have people lonely here. Right here. Statistically, right here, there are lonely people. Sitting with 10 other people, you are the most lonely person in the world. Right here. Right? So we need to know ourselves, right? Then connections, building relationship with others. It's not about quantity. It's about good relationship. You call them if you've got problems. We need a few who do that. Connections. Then the third thing that builds resilience is optimism. Optimism. That spirit of saying, I am going through problems now, but it's going to be okay. Don't need to know how. But you just got that sense of, I'm going to do something towards it, and I think things will be okay in the future. I can also ask for help. The engine of resilience is optimism. It's the belief that things are going to be okay. And when we bring it to teams, and I want you to think about your teams, because in a team, you can be very resilient. And then you've got people who are very ESCOM. There are good things happening in the country. No. You can't always be finding bad things. That you are not homeless is a good thing. That you've got a job is a good thing. That you have coffee in this amazing place It's a good thing. So we need to acknowledge you've got family. It's a good thing. Someone is standing at the corner and they're begging. Someone wants a job. Someone is poor. Someone has nothing to eat. So we need to say to ourselves, yes, I'm going through problems. I'm not where I want to be, but it's going to be okay. And it's so critical in the workplace. Absolutely critical. We've got all these water problems. Guys, there are good things happen even when there are water problems. You need to find them to build your resilience. You must hunt for good things in your life. No one can do it for you. You must say, what's a good thing? I've got a friend. I've got a loving partner. I've got kids doing well at school. You have to find the things. And therefore, in teams, we must be so careful. Why? Because there can be so much negative talk. It can drag you, and that breaks team resilience. You're trying to say, guys, it's going to be okay. We're going to deliver on this project. And then someone, in this organization, do you really think we can do that? I mean, it pulls you down. Do you see the role of the team? And so for you to maintain you say, whoa. And you say, yes, we might be having problems. You don't have all the resources. Working together. To the organization. The organization represented by the organization to stay critical. I have no places where this is why the manager this is why the manager thinks. This is why the individual has been put off for attention. Someone is a key survey, but it's Sunday. Just think about the conversation that took place. And I was told to talk about this conversation. Many old young lady, the previous year, also again, I would like to think. The person here is sunlight. So much brain says it too much. Don't you think it says it too much? It sounds simple. Saying they're struggling with mental health. Be like, hey, how is the money? Are you okay? Okay. We don't do that to glucose. We don't do that to high blood pressure. We don't do that to diabetes. We don't do that to migraines. We hug them. We love you. Hopefully you're going to be better. Why don't we do that for mental health? And that's the stigma that makes people not talk about it. And so picture that. This young lady comes and the manager says, I just want to tell you, last year you were booked off for depression. This year you have just come back. When you are away, I do your work. You are back now. You need to perform at the top. Otherwise, I'm going to put you on performance monitoring. And the managers are finished off by saying, it's not that I don't have problems. It's just that you go around telling people all your problems and you get admitted in hospital. Day one of coming back, Buffett. Do you see why I said we need humane organizations? We need managers to be trained how to engage with someone struggling with mental health. And I hope that paints a vivid picture of the role a manager can make or break someone's resilience. So the manager plays a critical role. I was counting. I lost track. I don't know if we're doing the same. The number of times workplace was mentioned. Did you hear how many times? Because the workplace can be a source of stress in many ways, but can also be a source of joy, adding value, right? So organizations have a key role for me in 3 ways. One, this idea, I'm going back to it. We are working with human beings. They happen to give us a lot of their time here. Their parents, their siblings, their active churchmen, they're doing other stuff. Therefore, when things are happening in society, like people are struggling with their finances, a manager looks inside and says, I'm sure that's also happening to my own people. What are we doing about it? What are we doing about it? You hear statistics from South African anxiety and depression groups say 1 in 4 South Africans arrive at work clinically depressed. They don't know. And if you don't know what depression is, let me just give you a simple definition. Depression is temporary inability to experience joy. I want you to think about that. Temporary inability to experience. You know, when you are sad, I ask you, you are sad. Why are you sad? You know why you're sad. Someone who's depressed, you say to them, why are you sad? They don't know. They don't know. That's how sad the condition is. And so we need managers who understand that. So therefore, they are not well. So do you see the role of the manager? 2, we need organization, and I heard about it here, to have proactive employee wellness programs. It is not good enough to say, we got life healthcare. We got careways for them. They must just WhatsApp the number. No, that's not care. I isolate myself. I don't want human contact. I don't want to tell people I'm not well. Do you think I'll WhatsApp? Managers must be proactive. To identify someone is not well, they must be trained. And we are talking about how are you? I'm not thinking about it. How are you? And then I'm telling you how I am. You're asking me about the project. No, I am talking and interested. How are you? Someone says I'm fine. You say, me, I don't do I'm fine. How are you? Because let me tell you, there where I teach at GIBS 2 weeks ago, I asked one of our baristas, call them service ambassadors. I love my coffee. They make us good coffee there. I said, Godwill, how are you? He says, it's Prof. So. How come so? Sing Godwill is crying. We go to the corner. He tells me the most horrific story. He finishes by saying, to me, I just want to end it. It's not worth living. And it's a horrible thing that had happened to him. I ran to HR, employment wellness program. Please, can you call this guy? And I'm not saying it because I'm a good person or I did that. I'm illustrating. Can you see how are you? Where it can lead. How are you? But wait, it's not how are you. How are you restore someone's dignity? I'm interested. You are human. You may not be okay. I am genuinely interested in how are you? And if you connect at a human level, look what happened with Godwin. Managers, organizations, proactive wellness program. Let me finish off with this. When we are talking about proactive, to build resilience in the workplace, for me, what is needed is the organization puts a proactive, in other words, managers are trained. We look at the data coming from the employee wellness program. We pick up trends. We look at absenteeism, and there's something going on here. Step 1. Step 2, in our mental pillar of our employee wellness program, we need to add resilience. Resilience is a program. You can teach self-awareness. You can teach social support, how to build meaningful relationships. You can teach someone how to be more optimistic. And there's a lot of studies that support that. So in your pillar, whether it's within mental health, you need to say, what are we doing? Why? Because as I conclude, you saw at the beginning my story of resilience. How does resilience work? It's this magic thing. How does it work? It works simply as follows. People and teams that are more resilient, they do things differently from people who have less resilience. More resilient teams, when we check, what do? They practice more self-care. They have a charter, they have an agreement in the team. Self-care matters. They're not going to say, this time of the month, you booking leave. Kanjani? How? Sifikela kanjani nje? Guys, I need self-care. My system tells me I need self-care. You are judging me. You are saying it's not okay for me to take it. It might look like easy talk. That is not good. So teams need to agree on how we do self-care, right? And so they are more optimistic. They prioritize self-care. They admit to making mistakes. They care for each other. And that permeates in the organization, right? You see that. The other thing, individuals who are more self-aware, the same applies to team. They're more resilient because they say, we made a mistake here. Things are not going well here. And they rally to say, how do we make things better? Right? So a team has to be aware what's going on. How many times are you in a team? You know, two team members talk to each other. They don't talk to each other. They don't like each other, and it's making the team not work. And you don't address it. That can be good for resilience. Resilient team say, no, guys, there is something not going on well with this team. We need to take it on. Let's talk about it. Self-awareness about what's happening in our team. And then thirdly, finally, the social support pillar moves from individual, the same in the workplace, to just say, are we really connecting? I want to finish off by asking you a question to reflect on. Do you really know your team members? I'm not talking about knowing their names. I'm not talking about knowing how many kids they have. Do you know their aspirations? Do you know their dreams? Do you know what drives them? Do you know what impact they want to make in the world? Do you help them find purpose? Caring leaders, caring managers help individuals find purpose. When you have purpose, you matter. When you matter, you are highly resilient, and you bring that into the team. Let me leave you with that. Thank you.
How are you, Brigadier? I once had a boss, and she told me that, not my current boss, don't worry about the current boss. She told me that the only acceptable answer to the question, how are you, is I'm fine.
Yeah, there you go.
And you're not allowed to share more than that. So, it was not a nice thing, but it's a good thing to reflect on what it means. But it also something to also think about not taking too much from people, so that too much to the extent that you can't carry it yourself. So you have to have that balance. But we also need to have a balance between what the boss is supposed to do, or the manager or the supervisor is supposed to do, and what the team needs to do, because it's a two-way street, correct? Okay. That means I'm well off to somewhere, right?
Yeah.
Okay, good. There's also a cousin of mine. He's married. Unfortunately for the ladies, he loves this line that a long distance relationship has nothing to do with kilometers. So you can be in a long distance relationship, staying with someone in the house. So the issue of loneliness is quite important, because you can be with someone and be lonely, and be with someone and be far from them. So it's one of those tricky situations, And then you know, I counted about 5 lastly from Dr. Meggs when he was speaking. So one of the things I also love saying, I have a lot of first and last as well, you know, because DG will be saying when she's sharing, this is your last point. So I always have like 5 last points, you know, so I don't break the instruction from my boss. So the second last is I lost my mother when I was 16 years old. But one thing that she used to tell me, I have 5 older brothers and sisters. One thing that she used to love saying is, you decide who and what makes you angry, you know. So that has stuck with me for the past number of decades. I'm 27 years old. Oh, okay, I identify as a 27-year-old. So anyone who wants to deal with me can't say anything because you'll be triggering me about, I don't identify with the age that I'm turning in a week's time. So 27 years old, that's me. But I think we need to take a number of questions from the audience. We rushed through the presentations so that we can have more discussions. I'm also told by the team that they have decided that so that we can build resilience, that we are going to have a braai after this at lunchtime. So we'll see so that we can build, most of you said you wanted to have partnerships, sharing of ideas and networking and so forth. So the lunch today will be a braai. So I want to see if we can be able to move everything so that we can, we'll push it, the lunch backwards a little bit so that we can be able to complete everything. So we'll take a number of questions. It's very interesting because in your presentation yesterday, ma'am, you asked if we know what makes us happy. And in the presentations today, we also had that coming out strongly. What makes us happy? When we come back to work, what does our work make us happy? Do the people we work with make us to be happy? Do they have to make us to be happy? Yes. Oh, okay. One of the things is we spend the majority of our times when we are awake in the office with the people that we work with. When we wake up, we shower, maybe have a little bit of breakfast, then go to the office. When we come back, we're tired, we shower, maybe cook a little bit for those of us who cook, have supper, then watch a series, an episode or 2 of whatever we want to watch, go back to our laptop, and then we go to sleep. So the majority of the time we're awake, we're spending it with people like Madluja, who makes me happy at work. So what are the questions that we have from the 3 presentations that we had today, but also comments, opinions that you have, that you want to share on how you manage resilience in your workplace, how you integrate people back into the workplace, how you work with colleagues, and maybe also what is it that you're going to change when you go back, you know, as an individual, because the workplace is such an ominous thing. It's made up of individuals. We make up the workplace. It's not someone or something that is an abstract thing out there. So yesterday we started with the right wing, not ideological. We'll start with the left wing today. Again, not ideological. Are there any? I'm being intimidated by this table. They want to go first. So I'll start with Madam here, and then the boss lady. And then anyone from this side who wants to make a comment? Okay, we'll take Dudley and then we'll take Ms. Govender. Okay, in that order, please.
Good morning. Thank you very much, Nico. Mine is a comment and not a question. My name is Ritabile Matolweni. I'm an occupational therapist. So as I was listening to Dr. Odette, my heart was dancing because she's literally speaking to the issues that are quite close to us as colleagues within the occupational space. And the issue of any condition can be reintegrated at work if there's systems in place, and that people don't work because they are well, but they work to get well, and therefore must create conducive environments for people to be able to work. Thank you very much.
Work to get well. That's an interesting concept. Thank you. Matosi.
Yes, when. So I just have two comments on this issue of resilience. I always say to colleagues, I've been working at IPSM now, this is my 4th year. And I've said, if there's one organization in my life that has helped me to prove how resilient to myself. So now I know that I can stand and say, I am so resilient because of the experiences, and the experiences in this department have been extraordinary, you know, in a way. But I just wonder, so this topic of resilience for me is a very interesting topic, Prof. Especially because we talk about managers and leaders as if it's people who are sorted out. And the truth is they're not sorted. One of the things that have helped me personally to be able to reflect how I lead and see how I improve, I may not be the best leader because I don't think there's any best leader, is that I did training and coaching. So I am able, when I go through difficult moments, to even self-coach. I know they say it's not allowed to self-coach, but either way I do it for my own survival. I do it, I talk to myself so that when incidents happen, you know, a few days ago, an incident happened that made me really doubt a decision that I took. And it's a decision about work, and it's a decision that needed to be taken. But the backlash that I experienced made me doubt that decision. And I had to go through my own process of understanding what happened and why am I feeling like this about this decision that I've taken. Is it about the decision or about the backlash? But coming back to my point is that managers and leaders are not sorted. We get into organizations where you even have leaders and managers who are working on themselves, but there are those who don't. People are angry. Exactly these issues that you are raising, people are angry. People are disappointed with life and all these things. So the idea of interventions to help people at different levels is very important. Lastly, how we treat people with depression or mental illness also it's informed by how the messages they communicate to how they should be treated. And they may not be, it's like when they say in a relationship, you teach a person how to treat you, you know? There's nobody who can just come and delela you without you opening a room or a window for yourself to be delelat. So and I see this in the workplace, that people with mental illnesses, and I'm talking about those declared because I don't want to declare people, you know, even when I'm suspecting, but this one, there's a problem, but I'm not gonna declare them. I will leave it as my suspicion. They encourage us at times to tiptoe around them as managers and as leaders. They encourage it. They will even tell you, I think my depression is coming now, or something like that. I'm like, and then I don't know if any of you were maybe on social media, there's a young lady, I don't want to say I coach because she's too smart to be coached by me, but there's a young lady I know, and I know very well, Malaika wa Azani. I don't know if some of you know her. She's a very bright young lady, but she struggles with mental health. She struggles with depression, and she's written about it in social media very widely. And she says something to me the other day. She says she's now doing a PhD in Germany. She's done 3 masters and she's got cum laudes in her masters. And she says to me, Sisioli, I am not my depression. I do not entertain my depression. At least she has that courage and capability to do it. Others may not have it. But the point I'm raising, Doc, is that yes, how we treat people with mental illnesses in society, in the workplace, we must also be taught by them and by the entire system, how differently should we treat them? Because yes, we tiptoe around them. Even me, even in my family, there are people who have mental illnesses who are undeclared, but we can see that there's problems here. You know, we can gossip about them on the side, but we are not going to confront them until, you know, there's a proper mechanism in place. But we have to tiptoe because so and so, and Udaba has always been this person like ongati akakho right.
Thank you, DG. Dudley? Please assist Dudley that side, please. Yeah, thank you. We must stop tiptoeing. And don't tiptoe around your point.
Okay, good morning, colleagues. I wasn't sure whether I should ask a question or comment, because I mainly support staff from the DPSA.
Do both. Do both.
Okay. I just want to say that I appreciated the presentation that's made by the doctor. Very systematic, step-by-step description of what resilient is. But sometimes we throw words around, you know, be resilient, but we don't give an indication that you can actually do it in a step-by-step way. That was a good presentation. I also appreciated the presentation that you opened up in the morning, the survey, deep sleep survey. I think I want to congratulate the organizers for taking that approach, because it's sort of, I haven't seen that being done before in these workshops. Sort of gave an overview, a view of what, you know, everyone is thinking at a particular point of time. And in a sense, it also suggesting the outcomes of, gives a framework of what the recommendations, you know, are likely to come out of here. So it's just a comment. Thanks.
Thank you. No, please send it to your neighbor. Thank you.
Thank you, colleagues, and good morning. There is this phenomenon that it's disturbing for us, but there is a term, and it's called the sick role. And simplified, the sick role is it's a role we adopt where we may be sick, but we use that sickness because it has other benefits for us. And benefits in terms, for example, if we say we are sick, then it absolves us of certain responsibilities, or we use it to manipulate other people that are in our lives. And I've dealt with many cases like this on a personal level. A person can use depression and anxiety and PTSD to hold on to a partner, or to manipulate at the workplace, or to manipulate expectations in terms of their performance in the workplace. So I would love to hear your views in terms of this sick role and some tips on how we can manage it better. And especially in the public service that is not profit-driven, where service delivery doesn't seem to mean as much to many people as it should. So how do we actually
I want
deal
to
with
clap
this?
for that question, you know, because I have personally been a victim of that. Where people will use maybe their disability, the declared sickness or undeclared sickness and so forth. And it's quite a very important thing that we must discuss. How do we separate real illnesses and real conditions with where people have it, but they are now stretching it beyond what you can do in the workplace to promote resilience and support them or reasonably accommodate them. That's what I want to do. I want to, if I can continue taking the questions and then you can respond so that you have more latitude. Okay, may we please have the online?
The first comment, it says, my name is Dibusing Kunwani from the DSD Northwest. I applaud DPSA to organize such informational 2-day session. I am of the view that in order to have everything right, DPSA should consider criteria or ratio for practitioners that addresses the lack of staff and work overload in the EHW sector. Number 2, address OSD of the professionals in the EHW. The second comment is resilience is one of the things that is close to my heart, and it insists one to tap into the reality and can make you understand yourself and others better. Thank you for the information.
All right. We don't have any hands?
Yeah, there's one.
Okay. And we thank the comment there about the informationals.
Samora, you can go ahead.
Mornings, colleagues, can you hear me?
Yes, please continue.
Yes, thanks to you. Firstly, let me just correct something, man, before I go into the presentation. The first presentees, they did not mention the Northern Cape when they were making their report there, that they were also in attendance yesterday, because we had a team from the Department of Agriculture, from our wellness, who were also in attendance with myself. So please, can they just make that correction?
We'll fix that. Please make sure that they have filled in that
attendance register.
Yes, please. Okay. Thank you. Please continue.
Yes, thanks. Secondly, Chair, let me also congratulate the people who presented this morning and yesterday. This workshop is seriously, this Indaba is seriously eye-opening. I just realized that we are dead, although we are alive. Because seriously, the things that were revealed needed one to go back and do a serious introspection. It is a fact that as public servants, we are just existing. We are not living as employees of this department. I must congratulate our DG, our DG for having organized this very informative work in Indaba. Chair, my only question with resilience that I want to find out from the Prof is that what must employees do, in particular of a particular unit that is tasked with the mandate of ensuring that you put a smile on the faces of not only the external clients of the department, but also the internal clients of the department. Then as a team, you came up with a clear model that will benefit both the department, the employees of the department, who are, for example, who are your extension officers, as well as the clients of the department, who are the emerging farmers. Let me just give a typical example. You will find out maybe there is a self-sustainable opportunity that farmers can benefit in terms of what they have. And you get investors on board through their assistance, because they are the people who identify these investors. And when you look at this thing that they are presenting, you can see it is economic viable. But when you take it to the authorities within the department, it's just shut down without any motivation, without any
are convincing reasons. And then at the end of the day, the poor farmers are losing out. They lost that battle. They came up with another strategy, a far better one than the previous one. And still this thing is just shoot off the table for no reason. So until when do you have to apply resilience as an employee of a department when initiatives coming from the ordinary people to better their lives are always just put in the unending pipeline and just keep on being promised and we promise and we promise. At the end of the day, you as the person who always reach out to them, you appear to be this person who's very unfaithful, this person who can't keep promises, but you are the one who's not making those final decisions. But
Thank
keep
you.
on
Thank
doing
you.
your work.
So what is the limit to resilience? Thank you. We got
Yeah.
the question.
Okay.
Thank you so much. From the Northern Cape, please remind your colleagues and yourselves to register there so that we correctly have everyone. And I also would like to remind all those that are here and even virtually to register. Even today, you are expected to please register. We'll also send when you register, we also send you the whole registration list via email. So you will have our numbers, our email addresses. You can continue having a community of your own on how you support each other. So it's quite important. It's not just for fun or for us to say we spent this much money and these are the people that were there. It's not only for accounting, it's a number of things. So please do that. I have a card here. I just want to have the Mrs. Ng Machaba to give me the code. They don't have to get the card though. I just need the code. You don't have to worry about the card. I just want to say I have it. It's with me. Oh, okay, there we go. You'll text me the code. Okay. Can we have 4 questions this side so that we can just close the discussion point? We have you, ma'am. We have, I apologize for not knowing the names, but please forgive me. So we have 1, 2, 3, 4. We'll do it in that fashion, please. Thank you. Please go ahead.
Thank you. Thank you. We acknowledge all the presentations rendered here. They have helped us a lot. What I'm doing now is not a question, but is a response from the brigadier yesterday. When,
Anxious, yeah.
yeah, I know. When she said, we must give ourselves enough time to sleep, because in sleeping, there's healing. And I agree with you, ma'am. So how can we sleep? If we, I'm not asking you. I'm not asking. I just want to
contribute. It's a good question. Yeah.
Yes,
Please continue.
Because I want to contribute something that it helped me.
Mm.
The only simple way to sleep is to take a deep breath with your mouth. Make sure that you fill your lungs with oxygen for some seconds. Then you release it through your nostrils. Then you repeat it the other way around. You take it with your nostrils. You keep it for some second. Then you release it with your mouth. You practice that. You will not, in a short space of time, it will be like you are in a theater. You just found yourself sleeping because you will have put more oxygen in yourself and your brain will relax, your body will relax, then nothing else can happen. You just sleep peacefully like a baby.
Let's go to the next comment, please. So breathing exercises. We will fall asleep. And we still have to drive home. Please go ahead.
Thank you. Good morning, colleagues. My name is Busangani.
Please raise your voice, ma'am.
Good morning, colleagues. Can you hear me?
Yeah.
Okay. My name is Bebusangani. I'd like to really say that thanks so much, DPSA and all your stakeholders for such a wonderful Indaba. And regarding the resilience story, we do know that there are challenges that we usually face, especially as practitioners, for us to be able to perform our responsibilities or duties to an optimum level, where you will have a denial to change or refusal to change, especially when coming from managers or supervisors. And what I have found working at GCIS, when people come to wellness and to say that I am not coping, I'm having this kind of a challenge and my supervisor doesn't want me probably to leave the office, but I can see that I'm not okay. We do look at the employee, and at times we go to an extent to say that with the powers vested upon us as employee health and wellness, we are releasing you to leave the office and go home because you are not well to perform your duties. We cannot admit a person in the wellness center at the sick bay for more than 2 hours, because that already, by virtue of you coming and be in the wellness center for 2 hours, it means that you are not well. You need to leave the office. But then now I think we need to equally look at ways on how to have managers to understand and believe their subordinates when they tell them that we are not well. I understand that we are having people who are doing essential work, where some they can't even take leave for the entire year because their job requires them to always be at work. So ways on how.
What job is that?
Pardon?
What job is that? Even the police go on leave. But continue.
Yes, so that we can find ways on how to educate managers to allow even those that are in the critical sections that are doing such essential work, that they need to be allowed to have time off so that they can go refuel and be resilient to come back and be able to do their job. Because at times where you find a person now coming, crumbling in front of you to say, I can't anymore, then they end up bunking work, then it leads to disciplinary action. So we need to find ways on how to deal with such. Thank you.
The next person was here on, oh yeah, there, sorry, yeah. I really need to know what type of job says you have to be available 24/7, 365. I want to find out what that is. Please go ahead, ma'am.
Yeah, thank you, Chair. Yeah, I also like to thank DPSA for organizing this workshop. It was a very, very, very informative workshop. And I heard the DG asking us, what is it that we're gonna do when we go back differently? My name is Chake Mukoka. I'm from the Office of the Premier. I'm responsible for transversal. Yeah, for oversight. Yeah, in all government.
Which office of the Premier?
Northwest.
Okay.
Yes.
Yeah.
So yes, we appreciate the information that have been shared here. And we should also, I should also mention that employee health and wellness practitioners are really doing their best to try and implement. But if we really want to have meaningful and changes in implementation of employee health and wellness, there are things that we really have to look at. First, we have to look at the issue of in fact, some of the things have been said. We know there are staff shortages, but we have to look at how we have been implementing the program, how the program was introduced, the approach that was used to introduce the program in different departments. Yes, we've got the strategic framework. It explains what should be done, but that the strategic, we've got policies, we've got step by step, but that is not enough because we leave it to department to decide how to implement, how to roll out the strategic framework. And our approach since inception is that we have, pitched employee health and wellness at this level, not at the high level. And it does not even appear in the strategic plan, even in DPSA. It does not even feature in the strategic plan of DPSA. And it does not even feature in the strategic plan, even APPs of different departments. So something that is not measured is not being taken seriously. Okay. So we need to work on ensuring better coordination from the DPSA. From the DPSA, through the office of the premier. My colleagues from the Limpopo mentioned that things, if they come
Please
from
put the mic close to your mouth.
yes, if information or instructions come from the DPSA department, cooperate. But I think as a program, if we really want to make meaningful interest, we need to look, seriously at the program design and implementation, how we design our program, and decide looking at the issues that employees are grappling with, and agree on the type of program that we need to roll out in departments. And they should be clearly designed so that we can have a step-by-step implementation of those programs and roll out in all government departments. The issue now is that
the mic next to your mouth.
okay, the issue now is that yes,
I want to hear this issue.
Yes, we've got so many programs that we employee health and wellness practitioners are expected to roll out, and which result in a piecemeal approach to program implementation. There are so many, there's staff shortages, and again, like I indicated, we have not pitched it at this high level, and the first thing that we are expected to do is to gain management support in our programs, but that is not happening. We don't have management support, and all the things that we're saying we should be doing here, managers should be, they don't know about the program. They don't know a program because they've never, in most departments, they've never been put through a training program. Even if you invite some of them to they don't pitch up because
they don't understand.
Yes, they don't understand. So if we can have a structured program, I think
let's make sure that in the commissions we deliberate on that and come up with ideas on how we must elevate the organizational pitch of these programs that we're having, so that we can have that clear understanding. We have a last speaker there. Oh, she already has a mic close to her mouth. That's good. Thank you for the comments.
Thank you so much, Chair. Mine is just a comment. My name is Pumla Mbande. I'm from DPSA, responsible for internal employee health and wellness program. I've taken a lot from different speakers since yesterday. And while sitting here, I don't talk much. I like to reflect. So I was thinking about how much our training requires us to upskill ourselves in terms of when we talk about employee health and wellness, one also needs to be trained also in occupational health and safety. So we are dealing with a lot. We also need to be able to manage diversity, because we are working with organizations that are very diverse in terms of race, gender, culture, even sexual orientation. and we need to understand a lot of things. I really need to appreciate the session today because it's given me a lot of information. I'm new in the organization, coming from Department of Employment and Labor. Now I'm at DPSA, previously from local government. So it's giving me a lot of information in terms of how do I deal with the different various issues within the organization, ranging from relationship issues between supervisor and supervisee, which results conflict, mental health issues, and various issues. So I think also as employee health and wellness practitioners, we need a lot of support in terms of debriefing and supervision. I know that is lacking in organizations because you don't only debrief to any person, you need to debrief to a person that is going to understand the concepts of the principles of confidentiality and all those ethical and principles and values. But I think that is one area that is a gap. What is also confronting me a lot now is how do we balance administration and also a need for us to implement programs? Because I find that there's a lot. I'm not sure whether that's only DPSA or maybe I've been in national government. I was in the provincial government, that where you find that a lot of your time you spend about maybe 70% doing administration versus doing the actual work. But all I want to say is I want to appreciate the different presentations and also the information that I gained from it. I think it's gonna enhance the work that I'll be doing. Thank you so much.
Thank you so much. Colleagues, I think what we are going to do will allow our panelists to maybe have a 5-minute response on all of these things. But then the majority of the things that are being raised are actually things that must be discussed by ourselves in the commissions. And immediately after the panelists have responded, we are going to take a 10-minute body break and then come back into commissions. The first commission that will be this side, all the virtual participants will join that commission. That is the commission that will be dealing with pillar that is going to be led by Mr. Des. That side, please raise your hand so that they can, but they know you, right? Yes. And then the other one will be led by Dr. Foromo. It will be on this corner here. Please make sure that if your colleagues are on the virtual platform, you don't go to the one that they are attending. You are on this other one on the side. Who's ladies first? Okay. Please.
Thank you, colleagues. It was great listening to your comments. And just hearing the real issues that are at stake. And I think the question that I wanted to tackle more was, I think it's Mrs. Govender who spoke about employees who sort of focus on their sick role. And, that's quite a challenge. I mean, even from clinical practice to in the workplace, it's always a challenge, where people do feel that their sickness allows them to manipulate the system. But just looking at some of the literature and what people have sort of been promoting nowadays is firstly early intervention. And even from regards to so speaking to as soon as there is an illness, intervening in the workplace early. So people have that realization that there's potential to work. I'm not too ill to do nothing. And I think that also part of it is now the people seeing the role for psychological, cognitive behavioral therapy, irrespective of your condition. So even if you come with a back injury and you feel that, okay, I'm not able to work, it's that overcoming that feeling that I can't work because of this issue. And even I know in the UK, they have started implementing this in, as soon as somebody is off sick, even from, there's a more social system there where once people are off sick and they lose their job, they then come into the social benefit system. And even at that point, there is already a system where people go to the job centers and they start counseling of trying to show people that they are capable. Yes, you may have disability, but you have also a capability. And changing that mindset, which is a challenge and it's no easy road, but the evidence seems to be out there that this is an essential. It's not a nice to have. It's almost a must have in these kind of programs where you are trying to reintegrate people back into the workplace. It's an essential component of it to change people's mindset into a capable mindset. And that seems to be having results, but it is a challenge, especially for people who have long sickness absences and have now assumed this identity that I'm the ill person in the group. It does bring challenges. So, yes, thank you.
Awesome. Okay, so I'll take the one about kind of limits of resilience, where you keep on getting no, what we heard from the Northern Cape delegate. I think all I can say there is we didn't really go a lot into it. I just spoke about it a little bit at the beginning. The idea of adaptability being an important component of resilience. So often that means also knowing what you can control and what you can't control. That's also a form of resilience, right? Because resilience doesn't mean, I'm breaking through all doors. It's also accepting that at my level, these are the decisions that I can make, right? And being very clear to the people approaching you with the idea that I make decisions up to this level. I'm going to take it forward to those who make the final decision and, it's not in my hands. So almost releasing yourself from that sense of, you might very well want the answer to be yes, right? But it's not in your power, to make that yes. So you need to release yourself from that control sense of, I want it to be an yes, I want it to be, I'm keeping on going. It's a hard thing to do, but keeping on and, I'm kind of getting a no. So I think that just helps in terms of expectations, because in my experience, often the pressure comes from that no has come and you need to communicate it. Right? And you do it the first time and you do it the second time. So perhaps say a little bit about boundaries, kind of just knowing, here's my boundary, I make decisions up to, and saying it upfront. And then if the answer comes no, just being honest about it to say, we presented it well, but the decision makers have said no, and kind of releasing yourself from it. And of course, one of the things I like saying, I just got an opportunity to hold it in here. Now that I'm here anyway. So, one of the things that really helps, and it speaks to this idea, I don't know about you, and it could just be, you can see the gray beard here, being a little bit wiser as you grow older. One of the things that has released me from that, so often we mark exams, we've got boundary cases where it's a mark and the person should actually go and graduate. But you see, when you mark the first time, and I give you 48%, then they do the average marks, it comes back. This student needs 1 or 2 marks to graduate. I want to give them the 1 mark, but there's a mark committee there that says, when you marked it the first time, why didn't you give that mark? If now you can miraculously find 1 mark and the student must pass. So there's a committee, right? And I have found making that boundary for myself, because it's a little bit similar to this, to say when a student comes, say, Dr. Max, it's just 1 mark. I said, I hear you, but there's an exams and marks committee that checks all that. I can't just mark and give you the mark, right? And so it's about appreciating what I can control, right? And often what I use, I'm sure some of you may know of it, is this idea of the serenity prayer. I really find it powerful to manage stress. Do you know the serenity prayer? Do yourself a favor. I have it on my phone. When things are tough, hey, I just go and I read. And I say, what can I control here? Because it talks about the courage to accept things you can't control and change. And then you want the wisdom, right? Let me go ahead. The wisdom to say, I can change this. So may I offer you the serenity prayer as a way to reduce stress and build resilience. Thank you.
Let's please clap the hands for him again. We have some token of appreciation. Thank you so much, Dr. Max. Thank you so much, Dr. Odette. You may be excused. You must also give yourselves for the presentation that you made. You have them there, right? Please give yourselves. And please show everyone that you did give them to yourselves. There we go. I want to welcome the DG of the province, our host, DG Makoko. Sorry, His Royal Highness Makoko Mampur. Colleagues, let's take a break for now. Let's please be punctual. We'll take 10 minutes break. When we come back, we'll go into the various commissions. When we come back, when the commissions finish, we will do, as part of the closure of the Integrated Public Service Month, we'll come back here, we'll do, whilst the teams are busy doing their closing, their presentations or their report back from the commissions, we'll have Oba King, who was one of the organizers of this Indaba, to take us through the pledge. But before she does that, we'll ask the DG of the province to tell us what is the importance of that pledge in the meantime. Then Obakin can take us through the pledge. Thank you. Thank you so much.
Don't worry, wherever you belongs, at the end of the day, you are going to get all this information. So if you are from the same department, don't sit in one camp. Try to divide yourself. If you are two, actually, you're supposed to be two or more, and then try to divide yourself. Don't all go in one camp. You should look one to one place. Let's turn the table like we look that side. Let's just turn the chairs, we look that side. At this side, are you okay? The way you resemble yourself? Okay. Okay. So we have got very limited time. We need the best 10 questions to answer from this side, and the best critical questions to answer both sides from the topic that I gave it to you. This side is HR role, functionality, how do you integrate wellness and behavior, and also as the management of mental well-being in the workplace is this side. And this side, we're gonna look on the aging workforce, as well as the management of fatigue and chronic illnesses in the workplace, this side. Welcome to the breakfast. We have four issues that is part in terms of what I think is the important part of this very clear. What is the main during the main to take hold and part of this now. If we look at the quality of the practice in our time, the specific that it has in the time frame. But how do we train this? Is the quality level to your satisfaction? Is there something that has been said in the quality and satisfaction? If we look at employee of the job, how do you integrate employee of the job for the and that's what I think what is there. How do you get from you and maybe from how and what strategy are we going to utilize to go forward? Let's start that. I think for the in terms of the difference of this, for me, it's first in terms of exploring HR and because currently I look at how things are in contact with more accurate and from get this I want to how can I ensure that things are become a effective part to your organization itself? Because that is what it should not be in terms of in the application of closing the application. What more than that is exactly that ensure that in terms of about so what all those further one element of the person itself. How do we ensure you best into the office when you is going to be productive? In terms of the notice employee around what strategies can you implement and what best strategies can you engage in terms of how do we promote employee around in our organization?
Communication, but one of the issues that was very important. We are being allowed in context to review more and again. It is as state as a state, much better. So that means you don't really get some money. But you are expected to actually deliver more in terms of what is it that you require of putting yourself. So, you know, very good idea to participate and I retire and go through your life. Turn to work setting. Sometimes I feel that it's not great. If you look at employee are bound to fact. He's a very favorite fellow. So many things. After 6 months, it comes back. And until it takes things to go back to work. It does come and do itself. But in that 6 months, in most cases, there's no interaction between the employer and the employee. He's on his own at integration. And how do you find that? For me, I look at there should be an interaction, even if it's just a monthly phone call that is being done to the employee to advise him what is actually possible. But how do we foster it? What do we need to put in place to make sure that those things are happening themselves? Data-driven decision making. I would say, but I try to make sure that the program that we involve for employee dollars is actually the basic finding data that we have. Identifying which are the illnesses in our specific department that we need to make sure that we advise the employee. We need to actually look at that and see how can we foster that itself, making sure that what data is that we give, where are they, how to get that data itself, who is the partner that we have to make to get those data so that they can get informed decisions. I mean, you cannot have a program on mental health, and the mental health is possible. You have really many things possibly. I can say this. So those are the type of things that later will be able to advise in terms of how you want to get more plan for yourself. And it's also in terms of supporting the we have a disadvantage. Or I have the studies that was focused on English. The question is why in South Africa don't they have the same studies? What is that we should do to make sure that those studies are being done and we can use that study as a baseline in terms of where to from here? Who should we actually contact to make sure that these studies around these studies are being done so that in terms of statistics, we're looking at our own circumstances. Our circumstances differ from what we actually do. The resources that they have, we don't have. So how do we make sure that with the resources that we have, we actually apply properly in terms of the areas where we live? I think in terms of the problem areas that we have to define, I think it's true. These management are considered a strategic actually part of the supply chain, and that is the thing. How do we think? And that is what I expect from the this is what we have to do. Bring out this and this and this. Make this and this. Make priorities. For me, the way I look at it is in terms of these management strategic issues is how to like department responsible for managing the numbers. Is if you have to read quickly, and leave it to our regular rate. Next year, in the public service, 6 declaration rate should be a very nice 5%. So any department would know and guarantee that can
the FSB of that department, I can take a personal interest to make sure that these departments and to make sure that we actually maintain at that time. Actually, these management or and trying to educate themselves. How to train them? How to get all satisfied at first and accountable for management. That's some of the issues that we have to raise and say how. Because we know what is how to measure the power of the staff. I think one of the issues that will come to mind is network support from the network and from the particular how do we promote that limited resources because we have to take management and interact with the resources. I mean, the you are allowed to kind of make this time for how do you make sure that somebody aside that's doing that person to make sure that what is the most important and before you but the only matter will really need then I will ask you to make sure I'm and very much and the student employee management for with our current situation in terms of staff, we should start everywhere. So somebody out of the office is to be present and somebody else in that space would be nice. And in terms of payment management, it's something that we want to put out. And that is the particular activity. And then I think what it is that the side of growth of what we did in that from in terms of one and step that was for our life that is for me it is how to I think people think the integration between HR and it's what like and design in terms of the step. But it doesn't step. That is not the case. So for me, that's in terms of how you make sure that this style of approach is broken. And that is one of the things that I want you to think about. And we have to come up with strategies to how to do it. So that is my I think I'm going to go to the floor. You heard what I said. There's issues that you have to think about. And I'm sure you have thought about. I'm sure you have solutions to the issues that are in the life. And now I'm just in terms of gain, we have two groups of people. Yeah, here one. So in terms of payment, as a part of that, yeah, in terms of the people in the land and our part having we have 1.38 level, the income will be from so the specific pay in terms of the distribution of the staff. But I think if it goes one here, I think those are talking of the right because everything that we see is something that we can insert and clear so what is the first question can I have a job and it's yes, the word employee out and down employee out and down so maybe they are So that is really what we do to make it fit. So we are in the whole country to start. That is because AI you do understand. Because if you don't know what it's like, but you also have to show it's that and the medicine for the place. So those are the things I do understand in terms of what is it I'm not sure really things that can use manpower, which you don't have. But so also you don't need it, there's a good, but the only thing that we do is thank you. And then the thing that I think the first strategy to align for the whole place. But the employee or the department. Yeah, the whole place can't be. No, that is not the amplify. What do you want to take of the because it is come to so you want anything that will go assessment of the thing. Eventually, yeah. Yeah, you have to get actually focus on specific. So that will be actually how do you play for the purpose and include the overall management of the So it doesn't matter. She asked for like one is movement for like for instance, she wants 1, 2, 3 and for us to be more fair like communities member states or maybe so that's something I by saying this. This is so, I hear you about this and now. So the one that we call the goal to the market. I know you can do it. What happens in life. Get something, it won't be the same. So what you look like, yes, we can come along with the same, but okay. You have to protect the race, the great issue that I like to take on the everyone and then come back to the what an answer. Okay. And then look at that, it's only that completely becoming the time frame. Now, and mother of the great mother, while they put down the star, you need the body, they use it. It is fake, to the time, and this time, and very, you just but how to train, you have to go back to the boundary time. So in terms of time frame, you really you get two things. I gotta do this to the thing. I think that I would do that. You look at the far chart. I know we have a lot of you. And we hear from you. But if we create a code, or we make it compulsory for the department to have a code, and employ actually together. And we make it compulsory with that. So that the discussion can happen. That's what we get. But I mean from you, so now, the managers who are in the science, I think that it was not, even to know what generally was that makes it. So now, if you get to know to come and there's nothing to know what to do, down, it's easy to be able to, and there's not more than just the right, you just take them and you can get the right to take it. One week and also you do it, make a focus on every presentation. So now next time I will send an analysis so that and of course, and I would like to almost cover some of those and what happens when you cover everything in the same There's no one who has said it will be. I would say maybe I think all of those things that you just
Colleagues, I'm giving you the last 10 minutes to wrap up. And then after 10 minutes, we are all coming in. By 1 o'clock, we must give the report here and finalize everything. So all of you, just wrap up your story. It's almost 12:32. By 12:42, I will come back and stop you.
obedience is needed by 80%. But the problem is the responsibilities of the health managers do not it's now what is and you can essence the difficulty perfect. Moreover, we also have, I would say, occupational health and safety program or occupational program in the department of health. Because when it comes to the challenges that we don't have to sort of engage experts or legal services in area you have very research for your overturning the laws. How about your extending to us and our first people and what you have they would say we will not have enough to an extent of I wanted and sort of limit but this clinic is functioning not extending what I'm saying. Not extending to the aspect the occupational in terms of that, where we need to and not family to note another provider. How about employments increase? Well, what events in the because the one that is only based for that what about our display? Why don't we have a mobile and where the policy allows
How long they think this cycle. I think that's the result. There will be a test. You can say, I like it because what and even if we have more really nice, what we by all and the air school has you can say that's why if you put up like okay, but you have to follow the activity once a year. So that you can see what the thing is. And those are the things that you can follow. My own work on how to manage the budget. And something that is done. But the same thing for instruments. Yeah, the practice. You must look at the income for your employees. What is doing? This is better than you have to approach it. And you are trained. That is a good thing. Then you there's no time. The employer must organize to train more. Remember, I do my best. They are higher and they're going to be another one. So I think that yes, you my on many many so we need to really intensify training as far as place and also getting the tools of dedicated so that is also made them whether departments are really supporting that training and what is important. So we are done. Oh, thank you. I don't have to say. Thank you so much.
Colleagues, as I promised that I will come back at 12:42, I am back. Mr. Nyiko is asking that we can give you 5 minutes break to recuperate your brain, and then we give our rapporteurs times. And thank you for your cooperations. I hand over, sir.
Thank you so much. Thank you. No, you are not handing over. You've already said it. Thank you. Yeah. So, go for them.
Colleagues, my 5 minutes break for you, it started at 12:42. And then I will make sure that from 42, 43, 44, 45, 46, then we stop. And then we start.
You have 4 minutes. Thank you so much. Yeah. Oh, let me do it so. Yeah, no, wait. Hold it like this. Hold it. See, it helps. There we go.
Thank you.
You're welcome.
Thank you, DG, for this opportunity. All protocol observed. My name is Promise Mhlanga from this place of the Rising Sun, Department of Education, Manager in the EHWP. So I'm here to demonstrate, but I have added one thing, DG, that troubles us, but we don't mind it. We have been talking about having a healthy lifestyle. It is also good to listen to our bodies because our bodies talk. If you eat something that is not acceptable in you, your body will tell you. So please listen to your body, because if you don't listen, it's where you develop the chronic diseases, because you are fighting yourself. The other thing, there are those people who don't simply go to the toilet because they are in a hurry. I just want to give you an advice free of charge. Let us drink water as we do, that's very fine. But when you go to the toilet, please give yourself time. Sit there in the toilet. Negotiate with your body. Take it easy. Pull it slow, step by step. Don't go. Don't leave the toilet until something comes out. So if you are in a hurry, you will say, Mina, I'm this person who doesn't go to the toilet regularly. It's your problem. You don't give yourself time. Sit there. Take time. I think I'm done. It will work for you. This one, this is the one that I'm here to demonstrate. It's so easy. I will just do it like this. Yeah, we can all stand. We take our first deep breath. You just use your mouth. Take until your lungs are filled with the air. Then you hold it for 3 seconds. Then slowly you take it out through your nose. Let's go. Then the other one, you now do it through your nose. You say, hold it. Let's go. You just do it several times. Do it until you feel sleepy. Don't do it now. Because you can do it whilst lying on your bed. When it is time to sleep. Thank you.
Yes. Thank you so much. I'm checking if there's someone sleeping already. No, you are reading your pledge now.
No.
Yeah. Colleagues, as public servants, We have the code of conduct that we are all supposed to abide by. The code of conduct, DG, includes the code of conduct includes a number of things that are formed from the constitutional values and principles, which are then what we derive the Batupili principles from. The DG of the province has kindly agreed to lead us in the pledging. So we will be pleased if we all rise. It's a very important work that we're doing. He will read it and he will lead us, and then we all read it as he has done so. Sir.
Please don't fall asleep. Well, I'm use my phone, I think.
Yes, isn't it bigger than
It's not helping me. I was already editing it in my head on the phone. Where are you? There you are. Okay, thank you very much. Okay, it says, and don't mind me when I edit as I read. No? So it says you must read after me. As a public servant, I promise to embrace discipline in the implementation of government priorities, comply with the legislation, portray compassion to all my colleagues and the public, and deliver efficiency in the performance of my duties. I obligate to abide by the constitutional values and principles guiding public administration in the execution of my daily duties as a public servant. I bind myself to A, serve the public in an unbiased and impartial manner in order to create confidence in the state. B, provide timely services to promote the development and advancement of all South Africans by putting them first.
Of all South Africans by putting them first.
C, respect and protect every person's dignity
Respect and protect every person's dignity
and rights as contained in the Constitution.
and rights as contained in the Constitution.
Not engage in any transaction
Not any transaction
or action
or action
that is in conflict with
that is in conflict with
or infringes on the execution of my official duties.
or infringes on the execution of my official duties.
Is that C now? Or is E? Where was I? Or something jumped, yes. E, act against fraud,
Act against fraud,
corruption, nepotism, maladministration,
maladministration,
and any other act which constitutes an offense
and any other act which constitutes an offense
or which is prejudicial to the public service, I assume.
or which is prejudicial to the public interest.
Oh, public interest. What is the interest? On my side, the interest has disappeared. Demonstrate professionalism,
Demonstrate professionalism,
competency,
competency,
excellence,
excellence,
transparency,
transparency,
and impartiality in performance of my official duties.
and impartiality in performance of my official.
And so I pledge.
And so I pledge.
Thank you.
Okay, sir. Thank you so much. I hope that we can internalize those words and make sure that as public servants, these are the guiding principles, pledges, and everything that we are supposed to drive us. Which commission is ready to report? You are finishing up. Okay. Even the other commission? I don't see the others. You're also finishing up. Okay. All right. So it means then I have to clearly it's going to be difficult. It's going to be difficult. Okay, Reds, there were comments that we didn't take from the virtual platform. Maybe what we can do will just to read those comments for everyone. And the other announcements that we're going to make is that those who still have points to make, they should send all their comments to desmondv@dpsa.gov.za. desmondv@dpsa.gov.za. If you have brilliant ideas that you think were suppressed by everyone else except the program director, please do so. I didn't suppress any ideas. Reds, are you ready? We can just take those comments. It will just be comments, even if it's questions, we can just read them, except those ones that couldn't hear when we didn't have sound.
Yeah. How do you build a resilience in a team that a lot of conflictual issues? Then there's a comment. My comment is to appreciate the DPSA for the Indaba after listening to the informative presentations. My concern is failure to manage time. Time is the highest stressor as it results in putting high pressure on the supervisor, translating to the subordinates. Hence, burnout, losing focus, frustrated, lack of sleep, elevated blood pressure, anxiety, depression, prolonged sickness. Solution is time management plus resilience.
Okay. So it seems like resilience, time management, and knowing ourselves remains the key themes that are going through. So, I wanted to ask before the brigadier left. She asked the question of, do we know what makes ourselves happy? I wanted to check what if it's someone who makes me happy? How? And it can be something, it can be someone, it can be someplace, it can be something, right? As long as you know what it is, right? No? Okay, but let's leave that one. But we'll find out what makes us happy. That's how we get to know ourselves, isn't it, Dr. Max? There we go. Ma'am, this is the second commission, or you want to project? Okay. Okay, please. You move it with this.
Good afternoon, colleagues. How are you? How are you? Are you sure you're really fine? Okay, Tulsile Longa is my name. I'll be representing the second commission under the chronic disease, management of chronic disease and fatigue in the workplace, and also the risk of aging in the workplace. Aging. The risk of aging in the workforce. Firstly, we started by defining what is the fatigue. Fatigue is an ability to cope in the workplace or wherever that you are, which results to extremely tiredness or burnout. Okay. And then we discussed the causes of the fatigue, physical fatigue and mentally. It is the inability to integrate the work-life balance. Someone needs to plan or arrange yourself in terms of balancing your workplace or work duties, and also balance with your home or home duties. You need to have balance. You cannot come at work and be prepared to discuss issues that are interfering with you at home.
But as colleagues, we are working together. So you must be able to communicate with others to make sure that we discuss and have solutions. Because as we are here, we are sisters and brothers. So we must provide support. Like, okay, I've already mentioned this one about the support. We must provide support during our in our team or group works. We must provide support to each other so that we will encourage everything that comes on our way. Insomnia is also the cause of fatigue physical. Insomnia is when you are having difficulties on sleeping, which is caused by bad habits. Maybe sometimes you tend to spend time watching movies, like around 11, you're spending time watching movies, you're busy chatting on WhatsApp or Facebook, and it's results to insomnia sometimes because you're misusing you're not performing the good habits of sleeping. Okay, we also have bullying. Bullying is caused, it differs. It happens from the management side, and also the employees can be able to bully the managers. So we should look at it in two ways because it does not happen from only one person. We also have mentioned the job misplacement. People feel like they are placed in the wrong directions. I don't know whether they don't know their job descriptions or it's because they don't know their duties. But some people do believe that they have job misplacement. Unhealthy habits, I've already spoken about this one. It's also caused by the bad habits, which is smoking. Maybe you smoke later and you're used to smoking almost each and every hour. Mind you, it is important to manage your health because you have only one life, so you must take care of yourself. So these are the management strategies that we came with. Encourage officials to take leaves and disconnect. It is very important to take leaves because you spend more time at work, so you need to spend time with your family and spend time just socializing outside the workplace. And some people use the leaves as some other way, that they spend time at work and do e-presentism, which they come to work, but they do not provide productivity. Awareness programs for fatigue and encourage physical activities. As the AHW practitioners, we should promote the awarenesses of physical health and other activities. This one, I want to emphasize on it. It is not upon you as a manager or as a colleague, but you must advise the next person that you see has a problem to refer to a therapy or just talk to that person to go and see someone if that person's feel confident enough to communicate about that. Creating a conducive work environment such as job enrichment. Creating creating conducive work environment. It can be when we have proper communication, where we communicate. If we have issues, we discuss those issues. We don't just sit and be like, I lost in trial. We don't do that. We communicate so that we will make sure that we have a conducive work environment. Debriefing for practitioners at least twice a year. I also want to emphasize on this one. The practitioners encounter a lot of things, as well as the managers, as well as other people who are dealing with, like social workers. But you must, at least once or twice a year, you must do the debriefing, because whenever you have a customer or a client that you must provide service to, you are supposed to be a stronger person to that person. I cannot communicate with someone who has a problem and cry with that person. You are not providing support. You are not giving me hope that things will be all right. So just be strong for me, be a pillar, so that I will have confidence that things will be all right just one day. Now it's the risk of aging in the workplace. This other time at DPSA, well, I'm working at DPSA, by the way. We had a meeting, we were discussing the succession. Some people assumed that succession is when Mr. Mabunda is working as an ADDG, and then when Mr. Mabunda retires, automatically Twilisile will replace Mr. Mabunda. So that's what they thought the succession would be like. But hear me out. The succession planning should go in this way. It's when somebody coaches me to understand or have the knowledge of that work and be able to understand and perform those duties. That will help me to enhance my skills, to advertise myself on the next person and get employment. Or if ever there are cases where there's lack of the professionals on that cases like finances, sometimes you want candidates, but you just don't find the right person to do that job. So in that case, you can be able to use that person who has that knowledge in the meantime while we are still looking for the right person. Improper use of leaves. It was mentioned that other people who are at their retiring age, they take they use their leaves improper. They delay the process, they apply for leave or short leaves to delay the process and make sure that they reach the age of 35 or the age of 65, just to pass time while they are still at work. On the retirement age, we discussed that the retirement age should at least be minimized or reduced to the age of 55 without penalties. So that people, because some people, they are scared to retire because their fear is because of the penalties. So they want to retire. In their corners, they want to retire, but now they are looking at the penalties. So now they can't retire. That is the issue. Yeah, this slide is so overcrowded, but it's fine. I'll make it up. Aging workforce mitigation factors. As I've already discussed, the succession planning, which is it comes with the coaching and mentoring, which improves the development of other people or people that you are working with, because you cannot be only coaching someone who is an intern in your directorates. By offering information to the next person, you are improving the knowledge of that person, because one day that person will need to know that information. I already mentioned the reduce of age group from 55 without penalties. Preventative programs that promotes healthy lifestyles. That one also falls under the chronic disease management, where the EHW practitioners promotes healthy lifestyle by physical activities and also relaxation. Pre-retirement programs, that also falls under the duties or under the activities that the EHW practitioners should do or can do in their scope of practice. At early age, at least at 45 or at least 50. As the EHWP, you should prepare the employees for the retirement. But some people, they are so ignorant, they can attend the programs, and when they retire, they just do something else. But we must make sure that the impact is felt, because you cannot count you cannot count your impact by counting the workshops that you have conducted. You must count your impact by making sure, seeing how many people did they do well after experiencing this workshop. Implementation of proper occupational health and safety measures within the workplace to provide a conducive work environment for the aging group. I've already discussed the conducive work environment, but as the government employees or the public servants, most of the time we spend time working in the offices. So the employer should make sure that the environment, it is conducive enough for you not to cause economic stresses or arthritis. You're always typing, so you must stretch your hands each and every now and then. You must stretch your legs each and every and then to make sure that you don't just get tired just because you've been sitting for so long. Okay. Strengthen the performance of management to the abuse of leaves. This one I've already discussed on the improper use of management, improper use of leaves. In closure, I would like to say to the employers or to the HODs, it would be better for the HR and the HW to integrate. But in an integration, it's not when I'm saying the HW practitioner should do the labor relations duties, because you cannot be comforting me and then the next time you want to fire me. How would that look like? So when I talk about the integration, I'm talking about where the HW practitioners will be able to share information, like reports that are used by HR practitioners, they should share them with the HW practitioners so that they will have enough information. Thank you.
So labor relations practitioners are there to fire people. They must stop firing people. The next commission, please. Let's clap for them.
Yes. Greetings to the DG, the DDGs, and to the House at large, all protocol observed. My name is Babalwa Mosala from the DPSA under the branch HRMND. So I'm here to give feedback from the commission proceedings. We were dealing with the HR's role in employee health and wellness and the policy and procedure on incapacity leave and ill health retirement, which is the pillar in short. So in our proceedings in the commission, we explored the critical aspects of the HR's responsibilities in promoting employee wellness being and managing the policy related to incapacity leave and ill health retirement. So these are the issues that we have identified during the proceedings of the commission as follows. So we have identified that the pillar do not provide the role of the employee health and wellness. Therefore, there are also shortcomings in the relationship between HR and EWH, which needs to be more integrated so that we can break the silos between these two elements, which in essence, we mean that HR and EWH, they must work hand in hand. Also, the supervisors are not managing leave. They're not managing leave as their responsibilities. They take everything that has to do with leave to the HR. Also, there is a problem when it comes to leave to the normal leave, sick leave management, which is not properly managed. Also, we have identified that employees are sensitive to provide medical information when it comes to PILA. Then we'll discuss, we will dwell more on this when it comes to the proposals. Also, that the managers, including the line managers, the supervisors, everyone, they're not capacitated enough to deal with the PILA. Also, the adherence to time frame is lacking when it comes to PILA, when it comes to the investigations of the cases of the employees. Here are the proposals that we have come with during our commission, that there should be an amendment in the pillar policy to include the role of EWH. Also, to establish departmental forum to foster closer collaboration between HR and EWH. Also, EHW. I'm sorry.
It's okay. Everyone can come first. It's fine.
Okay, apologies on that. Yeah. All right, and then also the training on pillar to be made the responsibility of health risk managers. Also, there was a suggestion that there should be an improvement of the sharing of reports between the health risk managers, the human resource, and the employee health and wellness. Again, the better establishment of the case management committee in each department to be provided in the policy framework. Due to time, we couldn't discuss more and we couldn't discuss the mental illnesses. So these are the contact details. Any other furthermore inputs, you can forward the inputs to Mr. Desmond on desmondv@dpsa.co.za. Thank you.
Thank you so much. I think employee health and wellness can also be employee wellness and health, right? Yes, there's nothing wrong there. In fact, some provincial departments have now started emphasizing more on health and well-being, wellness and well-being. So maybe you are pushing us in the right direction. Colleagues, I want to thank you for allowing me to be the driver of this program. I'm going to sit down now because my boss will be the one speaking. And once my boss speaks, no one else must speak in terms of protocol. But I want to thank you, and I want to thank the presenters, the rapporteurs. These are the future of the public service, and we want you to make sure that you give them this type of opportunities. Thank you so much.
Let me start by thanking you, Nico, for doing your job well. There's no bonus in government. And also thank the team that has been working with you. I know that you were running with a team of young people, what some call the crash. Where, kindergarten, yeah. You were running with a good team of kindergarten. And thank you to colleagues from the department, the young graduates. When we recruited them, we called them interns, but they don't like being called that, some of them. So I'll be safe and say thank you to the young graduates. I think all the young people who have come here in front from the department are in our graduate program, Nico, all of them, except Red. Yeah, Red is an employee, but the rest of the colleagues are on the graduate program. So it is our wish that even those will not be able to offer jobs because we don't have a big structure, but they can make networks through being exposed in these platforms, and they will know when they go to the interview to have experiences of having had to deal with challenging situations like today when things are not working out, you have to improvise. So we hope that those lessons, guys, you are cementing them, you are reflecting around them, because they are part of your experience in the world of work. So thank you very much. And thank you, Nico, for allowing them to run around and do what they do best. I think bakhululekile, they look happy, and I hope they are happy. Colleagues, I'm not going to say much, but I think this was very successful, and they didn't write any notes for me or any speech for me. So if I say things that are out of order, blame them for not managing me and controlling what I say. Linda was saying earlier on, but when they write speech for you, you say, no, they wrote a speech for me and I'm not going to read it. Even if I don't read it, there'll always be points that I get from the speech. I just don't like reading speeches, but I'll still pick up a few points and play around them. So the speeches have a role to play. So I'm supposed to speak about the way forward, but before I do that, I just want to remind you that today we're actually closing the Public Service Month. September is the Public Service Month, which means we are entirely focusing on how we can improve service. And when we conceptualize this Indaba during this Public Service Month, our motivation was that we always talk about everything in respect to the service delivery. except the people. And yet the people are our assets to deliver services. And these things that we are observing around our people, how do we confront them head on? And Nico and the team went out to put together information, a proposal. Dr. Robert Foromo sitting over there, and Desmond. Desmond, I forgot your surname. Van der Westhuizen. Actually, yeah, the only Desmond I know was that Desmond Golding who was in KwaZulu-Natal. Yeah. So both of them as well, a core team of policy owners that work under NICO to conceptualize the program and also direct to the right people to be invited. I think you were really a group of right people for this session, and thank you. Thank you, DG Makuko Mangpuru Mhlobam. Siyabuyana next year. Ubaska Koshwa siyabuya. Siyabuyana next year, but thank you very much, and your team, Umfundisi, and other people who are working with you for supporting us. Nico was complaining that you didn't put much money, and Umfundisi was saying, but there is money put. It doesn't matter how big or small it is. And the province did the biggest issue. It brought the people, because your conference would be empty and the walk wouldn't have happened without the people. So, and I was telling Nico that, yeah, money is scarce. So we don't go to our partners and to provinces because we want money. We go because we think there's something that we can do together as partners. Of course, it needs to be financed. So when there's an opportunity to put something, we appreciate it. So thank you very much for the support. I hope this will also be extended to the other colleagues who may not be here, who have been working on this program from the province. This program started with the Hockey Talkie on Wednesday, which I couldn't attend because I had to go to another conference in Joburg. But we started this Hockey Talkie idea last year and tested it, and we thought it can work. And James enthusiastically joined it. And I think Alex Forbes, when we started it, and then I think the principal officer of James likes that program more than everybody else. He actually looks forward to it. So thank you very much again for that support to the province. Our partners from people who work with from the industry that we invited and raised their hands and came through, we appreciate that a lot. We will not be able to cover the ground we covered without your support and insight of the understanding of the issues that we are facing as public servants and the relevant solutions around those issues. So in terms of the way forward, and I'm thanking everybody. I just mentioned some of them, but if I don't mention you, you're still very, very important for the success of this event. If I don't mention you by name, thank you very much. I think that we've started a review process of our strategy, the 4-pillar strategy that's focusing on wellness and transformation. We've started the process of review, and that information that you have given us that was presented earlier on, the reflections from the questionnaire, is going to be it's critical and essential information for the work that we are undertaking. And some of the things I would like to see happening, I have not been given speech, so things I'm talking about, they are from my own brain only, because the other brains, they have not given me anything to say. So I would like to see a reference group coming out of this exercise, bringing a few people from provinces, a few people from national departments that are here, and people from industry to take this process forward, because I don't want, thank you. I don't want Foromo writing the policy alone there by the office and Desmond occasionally making inputs on pillar part of the presentation. I want an integrated approach, and I want the evidence and the experiences and the insight of people who are implementing from the ground to inform the work. I think it's very important for me, and the evidence that we have from our industry colleagues who are supporting us with implementation is very important. So for me, the reference group, multi-stakeholder reference group to take the process forward. I would like us also to have some form of policy-driven engagements, and this can be virtually. We don't have to meet all the time, but to isolate a few policy issues that have emanated out of our conversations. There's a lot of policy issues that we need to tease further. I mean, I think we can take a day just speaking about management of leave in the public service. Some of the horror stories I hear even in my department about how people do favors for each other. Well, I hear them as gossip. I don't know if they are true or not, but you know, amaXhosa athi kungaqhuma kubasiwe. I can't say that in English. I'm sorry, guys. I can't interpret it. Where there's smoke, there's fire. My learned friend is assisting me. So I think that Nico, coming out of this and forum, we have to have a very clear program of policy discussions on these particular matters. And I hope I don't have to follow you up, guys. No? So because I'm still being nice, let's keep being nice to each other for a very long time, because things can change quickly. I think the third issue is follow up on some of the offers that we received. I never forget offers. Ask this one. I never forget. If somebody promises something, I'm following it up. Upud Madlisa promised something, you know, made an offer around a pillar in Indaba. I think it's important. I think we really must talk about pillar. And my issue about pillar is, why are we not integrating even our approach to wellness and sick long-term sick leave management? Why are we not integrating? One of the colleagues who was speaking yesterday was saying that, or was it today, saying that as practitioners, sometimes they need a debriefing. There's no person who's gonna debrief her in the department. Me, I'm not trained to debrief anybody. Linda is not trained, your immediate boss, or you are trained, but you are not doing it because you are not debriefing. You have never debriefed me in all my problems, so you are not doing it. So, and yet we have access to a wide range of professionals through the pillar contract. Why are we unable to tap into that to ensure that our pillar practitioners get an opportunity? I think like when you work in SAPS, you are a police officer, you get an opportunity to debrief a certain number of times a year. Some don't do it because they are strong Black women and men, or strong people generally, because it's not just black people who work there. So that integration for me is very important. I'm just making an example about this, but there's many other areas of possible integration. Pillar is on its own as a program is very expensive already to us as government. When I say it's expensive, I don't mean you are charging too much. Colleagues who are implementing pillar, who are supporting us to implement pillar. I'm just saying that government spends a lot on it. So there's a potential for lots of value that we can tap into it that I think we're not tapping into it. The other thing I'd like us to follow up is that offer on professionalization. I think that colleagues from IAPSA and colleagues from Metropolitan have made some offers that we need to follow up. And my issue, I don't want to get involved on industry squabbles because I deal with enough squabbles in the department. I'm not interested in new squabbles. My issue is really that we must work with people who have raised their hands and who would want to work with us in government, because we have at least extended invite for participation to almost everybody for this conference. So those who are available have raised a hand. We are not going to stop working with them because we are waiting for the others to come through. So I don't want us to get stuck into politics. I deal with politics every day in the department and in government. So my threshold and appetite for politics is very low when it comes to this work that we're doing. And then there's an issue around the 4 pillars, the fact that we have to review them. But as I was taking notes, it was quite clear to me that we need to consider, and I don't want to put views up front and said we need to consider pillars, additional pillars, but I want to say we need to consider strengthening certain things. This thing of building resilience, we need to unpack it from a strategy point of view, from a policy point of view. What is it that we think we can do to support employees building their own resilience and our organizations being resilient? Because our organization is our people. And if our people are not resilient, the organization is not going to move far, because we depend on our employees in the public service. 65% of them are in frontline service delivery. We have 1.2 million public servants on operation, on estimation. This is national and provincial governments only, excluding local government. That's what we are responsible for as DPSA. Out of that 1.2 million, 65% of them are found in service delivery points. They could be educators, they could be police officers, they could be social workers, they could be home affairs officials at the interface with people, they could be social development officials, and etc. So we cannot leave our people behind. We have to work with our people. So resilience is an important discussion and topic that we must think about and see how we embed in the strategy itself. The issue of mental wellness of our employees is an issue that we must also really, I always say COVID for me has just made it so apparent that siyagoa sonke. Siyagoa, I don't know what to say differently, how to say it different, but siyagoisha. Sonke, everybody has their own problem that can make them, even if they think they are still at the acceptable level of insanity, but you can quickly tip. So we must appreciate that. And our strategy must be very pointed in how we are going to ensure that we prioritize issues of mental wellness and support that even leaders and managers need, but also those, the employees themselves. I think it's very important. Actually, for me, this is one area that I kept on, maybe to some extent annoying even Nico about in the office, because I kept on saying, we have to do something. We can't just fold our hands. Even in the department, we have to do, hi, K-Ways. I'm like, I can't feel K-Ways at all. I can't feel whatever we're doing if we're doing something, because cases that come to me of colleagues who are fighting, as nje uyayibona ibhalwe phansi grievance bale, ikhona underlying issue and it's big. Disputes, all kinds of things that are taking place. And I said earlier on, I can't deal with these things. And even though our labor relations unit is so overloaded, we're a small department, but our labor relations unit is so overloaded with grievances because people are going through a lot and we are not having a system of really assisting to get deeper into the issue. And sometimes there are those, when you even want to refer them, they say, no, I'm fine. I have my doctor or I have my priest. What do you do? Oh yes, or I have my Kobela. Yo, I've heard that actually as well. I have my Kobela is training me. So I don't need any other help. So those who don't know Kobela, what is Kobela? I have my Sangoma who's training me. I don't want to use the English word that they use because I'm not sure about it. So I'll stick to Sangoma. So, yeah, so colleagues, those are some of the things that I've picked up being part of this gathering. And I am hoping that we will go back, talk about timeframes, talk about the reference group and everything, have a plan, which I will monitor directly, which must deliver a reviewed strategy. By when, Nico? What is our target, Konji? Foroma, what is our target? That one is being dodgy. End of Q4, which means by then we must have a strategy that is approved. End of Q4, March 2024, which means if it's approved by me, it must be in my desk by when? By end of February. Yeah, 4 weeks to go through the process. If it's approved by the minister, it must be there by when? End of January. 8 weeks for approval processes. So that's my story, colleagues. And I just want to say, thank you very much. Go home safe. Those who are driving like me, we must drive in peace. Those who are chilling around, still trying to find what else they can do in Mpumalanga when we're not here as delegates, enjoy yourselves. And colleagues from Mpumalanga provincial government, I am really appreciating and grateful. Colleagues who are joined virtually, we still have them. We really appreciate your support that you joined a 2 days conference of this nature virtually. We understand the cost containment measures and we know that not everybody could be here. Initially, we planned for 200 people, but we had to scale down our plans because of the cost containment measures and our own reality right now in the public service. Thank you very much.